grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much knowledge, so much skills, and so much experience from this event.
I think this is the very good start if you want to embark your journey in doing research.
It was a remarkable event for us. We met a lot of young scientists and people from all over Indonesia that we would never ever dream of to connect with if not for this event.
Thank you for arrange this Genomics Dojo. It really helped for the junior researcher like us. Thank you so much.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking. So it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It is a really good platform to grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much knowledge, so much skills.
It is a really good platform to grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much knowledge, so much skills, and so much experience from this event.
I think this is the very good start if you want to embark your journey in doing research.
It was a remarkable event for us. We met a lot of young scientists and people from all over Indonesia.
It is a really good platform to grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much knowledge, so much skills, and so much experience from this event.
I think this is the very good start if you want to embark your journey in doing research.
It was a remarkable event for us. We met a lot of young scientists and people from all over Indonesia that we would never ever dream of to connect with if not for this event.
Thank you for arrange this Genomics Dojo. It really helped for the junior researcher like us. Thank you so much.
Udah. Cek satu, cek, 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 cek satu, cek, cek, satu, cek, cek. Make sure.
It is a really good platform to grow, to develop our research idea. It is a really good platform to grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much.
Tetap aja, maksudnya jangan sampai terlalu mengganggu karena kan ini juga aku cek dulu kan. Cek cek cek. Kan aku MC nih, aku MC, aku baiknya
nanti blockingannya panggil ini kan narsumnya satu-satu.
panggil narasumber. Aku mending di tengah aja.
Mending di tengah sih.
Di atas panggung.
Di atas sama di bawah. Di atas aja deh.
Aku deket meja aja kalau gitu.
Iya.
Baik, makasih. Okay, good morning, ladies and gentlemen. We would like to welcome you all to the 2025 Genomics and Science Dojo Dissemination. And before we begin, we kindly ask you to proceed to your preferred seating, and we are going to start our event shortly. And before that, if you have needed any Okay, we will begin our event today. Before we start, I'm going to say hi to all of you. Good morning, everyone. Good morning. Seems like everyone is on spirit today. And also, we would like to welcome you to the 2025 Genomics and Science Dojo Dissemination. And we are proudly to have you all here, participants and all the participants from the public. We are going to have an exciting sessions so we can discover new perspective on this program. And also, for today's dissemination, let's aim our activity with bright perspective, and let's make today just as productive and rewarding. And before we start, let's take a moment to appreciate all the incredible participants, speakers, and organizers who have made this even possible. And Genomics and Science Dojo is organized by the Summit Institute for Development in collaboration with Genomic GSI Lab and the Oxford University Clinical Research in Indonesia. We are also truly grateful for the British Embassy and UK International Development for making this initiative possible. And to start, we will hear an opening speech from Summit Institute for Development representative for Pak Martinus Pradipto, Director of HR. We are going to hear your speech. The floor is yours.
Hi, good morning, everyone. Do we have a jargon or something to lighten up? Okay, so whenever I say Genomic and Science Dojo, please say Ganbare, okay? Genomic and Science Dojo. Okay, one more time. Genomic and Science Dojo. All right, thank you very much. So yeah, please have a seat. It's okay. Okay, thank you very much for coming. Actually, I'm Martinus Pradipto. I'm the HR Director of Summit Institute for Development and also the Secretary Foundation. And we would like to thank you for all of the participants, all your efforts, and also all your time that you allocate for these activities. And also, I would like to say thank you for being here. The judges, if there are any judges here, oh, there's some. And then the senseis, Dr. Anuraj, Dr. Ariel, you're there, Dr. Ariel, hi. And also in the camera. And then, and also the other sensei that unable to attend at the moment, maybe they will be able to come later. Bu Ati also, hi Bu Ati. And yeah, Ibu Yuni Setiawati, the CEO of Summit Institute for Development, and also not forgetting the one who sponsored and also supporting us. All this activity able to be done because of the British Embassy Jakarta. Hi Julia, and also Rifa, and say my regrets to Riris. Okay. Yeah, I know that this journey is not easy. I know this has been taking your time, a lot of your time, but there must be a lesson learned. There must be a lesson learned. Why? Because even though you've been following this cycle from the first cycle, maybe some of you from the second cycle or the third cycle, but what is the lesson that you're able to get, right? This is like a preparation for you to go ahead in the global community. How do you defend your idea? How do you defend your thesis, perhaps, in your PhD? And then how do you defend your articles? It's all the stepping stone. It's all starting point that you're able to be a bigger and responsible and also better person. So let's not stop here, not just at the dissemination events, but after this, we want the dojo and Genomic and Science Dojo to be sustainable. So if you're able to bring this to a broader stage, let's say in your campus life, in your office life, or even in your organizations, it can be applicable. So the dojo ways, it's always be able to be applicable anywhere, anytime. And I think we would like to celebrate this because it's really, really, well, how do I say that? It's really, really breathtaking because following you all from the first cycle, grand tournament, and also now the workshop yesterday, it's really, really great to see how the progress is being made. And I hope it's not stopping here. You still have one thing. Remember, you still have one thing to be complete. What is that? Yes, the submission needs to be accepted and make sure that you get the support from us. So make sure if there's a review come back to you, make it done as soon as possible. All right? I think that's all from my side. Thank you for everyone that coming today. And if there's anyone that I haven't mentioned, maybe Bu Irene, I forgot to mention you. Thank you very much for coming. That's all for today. Let's do the workshop and dissemination events, hoping that this event will go smoothly. And remember, it's not the end, okay? Maybe one last closing remark. I got this from Panuraj. Life is not easy. Life is cruel. Being intelligent is not the only option or weapon that you need, but you also need to have courage and also honest in your life. So don't stop trying. Even if you fall, you have to go back and try again. Thank you very much.
Thank you, Mr. Tinus, for the opening remarks, and thank you for the motivating speech for all those who participate today. And next, we are going to hear remarks from a GSI lab representative, but unfortunately, Dr. Ariel is not going to join us here, but we are going to watch his opening remarks through the screen.
Good morning, Bu Iren, as the representative from BB Binomica. Good morning, Julia Robertson, as the health advisor from British Embassy Jakarta. Good morning, Bu Yuni Dwi Setiawati from Summit Institute for Development. And also to honored senseis and co-founders, Professor Anuraj, Professor Rina, Bu Ati, Pak Husna, Mas Adit, Mas Edward, and many others. My name is Era Pradipta, and I'm from GSI Lab, and I'm really glad to be given the opportunity to play a part in Genomics and Science Dojo. This is an initiative that we all have realized to be important because in Indonesia, as is the problem in the whole world, research, science, and communication with the public will remain an issue for a very long time. But even with that in mind, the research itself still has a large issue, which is the researchers. Gotta be honest, we often feel how hard it is to just do good science. Funding structures, local paradigms, limitations from infrastructure, or even from outside influence. Science moves so fast that often we feel that we cannot catch up, especially in Indonesia. Through Genomics and Science Dojo, GSI Lab, Genomics Solidaritas Indonesia Lab, believes that there is a way to create an environment that is conducive for science to progress as fast or even faster than other places in the world. The meaning here of Genomics and Science Dojo is how we innovate the way we think, finally communicate our findings through publications, through discussions, and most innovatively, through our Dojo tournaments. Dojo tournaments is a way for us to finally confront our ideas by asking our colleagues to see what is wrong with our baby research. We all have this tendency to feel like, oh, this is our baby and this is what we've been growing with for so long, that it's hard to see from all angles the strengths and the weaknesses, and sometimes, let's be honest, the bad parts of it also. Sometimes we miss ideas, we miss perspectives. We rarely get the chance to find an environment where we can feel safe, but yet encouraged to challenge ourselves and others. And that is why we are eternally grateful to British Embassy, Summits Institute for Development, and our team members in GSI Lab, Faculty of Medicine, Universitas Indonesia, OCRU, and many other places, and you, the participants, for believing in this mechanism, for believing in your research to be good enough to defend against other researchers, and to believe in yourself to be good enough to challenge other research. We are grateful that this is the second year that this has happened, and we are grateful to all the committees and also to all the support from participants and also from many different parties that I cannot, for the sanity of us all right now, to mention all one by one. Again, we cannot wait to see how we can go out and finally show the world, well, not finally, but slowly being ever more stronger to show the world that we are daring enough to challenge ourselves to be better researchers again and again and again, and hopefully we can overcome hurdles that have been plaguing us for some time right now. Thank you very much. Again, we hope that this continuing effort can receive support from all of you and can receive the same faith and the same courage that you show along this event for the foreseeable future. Because we now see how strong it is when you believe in yourself and you believe in your findings. Thank you. Thank you very much. I return to the MC.
Though Miss Dr. Ella is not here, but we can see his spirit by wearing a kimono we wore yesterday. And so we are going to hear opening remarks for Mr. Andora Shankar as a representative from OCRU and also a science representative. Please give an applause for Dr. Shankar, and the floor is yours.
Thank you so much, everyone. Great to be here. Welcome, everyone. Ibu Yuni, Ariel, thank you for your, wherever you are out there. Thank you for being here with us in spirit. And of course, Julia and Irene, many fantastic folks here have supported the dojo. Ati, thank you so much for being here. Ahmad Utomo, yes, thank you so much. Fantastic. And our super champions from last year. Where's Edward Sudanto, first world Shinjitsu champion. Right, and amazingly, the coach of this year's World Shinjitsu Champions, Sylvia and Nuha. So there they are. Give them a big hand. Where is Sylvia? Oh, there she is. There she is. Yeah, so I think this really highlights the excitement and the importance of the dojo. As Ariel mentioned and as Tina said, that, you know, the work here, it's really about bringing everyone together, everyone contributing, creating something new and exciting, a way to overcome many of the challenges that you have faced before. And the goal of the dojo is to create a safe place, even though maybe you didn't always feel safe, was to create a safe place for you to challenge each other, right? Because often, as we know in many countries, Indonesia included, all scientists, even in high-income countries, there is a hierarchy, and sometimes it's not acceptable. It's not okay to challenge another person who might be your senior. And so here, we want to make sure that people start to practice that, to understand how to do that, right? Science is about being wrong, as we've spoken about before. The structure of science is you have to propose a falsifiable hypothesis, right? So that means science progresses by being wrong. So there's no shame in that, right? So this is really the exciting thing, is enabling us all to come together to invent a method, a new method to train people in this. You're all co-creators of something that never existed in the world before, which is the Genomics and Science Dojo, creating a new intellectual combat sport, Shinjitsu. And this is an innovation to the world from Indonesia. And I think that's what's most exciting. So if we're able to continue to innovate on this, expand this, I think that'll be extremely exciting. So with that, opening the rest of this dissemination ceremony, very happy to see you all here, and I hope to see all your faces again a lot more in the future. And hopefully that will happen with support from everyone here and possibly the British Embassy and others. So onward and upward. Good.
Thank you, Mr. Shankar, as our loyal sensei. And Mr. Shankar has many roles during this dojo. And we are glad we met an amazing person, and we would like to continue this. We are going to hear opening remarks from Julia Roberts, Health Advisor for British Embassy. Please welcome Miss Julia.
Hello everyone, selamat pagi dan salam sehat-sehat untuk kita semua. Good and warm welcome to all distinguished guests, colleagues, and most importantly, the participants of the Genomic and Science Dojo. That I would like for you to raise their hands, the participants. So, oh wow, too many ladies, I like it. Sorry about the guys, but distinguished guests, Ibu Irene Lorinda, Indalao from the Ministry of Health, Ibu Yuni Dewi Setiuyati, CEO of Summit Institute for Development, Dr. Anuraj from Oakru University. My name, as been mentioned, is Julia Robertson Takahashi. I'm the health advisor at the British Embassy, Jakarta. And I'm delighted to be here once again, especially after meeting many of you during the mini dojo and the grand tournament. It's a real pleasure to help close today's Genomics and Science Dojo dissemination event. This marks an important milestone, building on the momentum from Dojo 1, taking things even further with Dojo. But the Dojo isn't just a training, as you mentioned. It's a response to real need. Research plays a critical role in shaping evidence-based policies, improving healthcare systems, and addressing public health challenges. In a country as dynamic and diverse as Indonesia, strong locally driven research is essential to understanding health needs and design effective solutions. That's what the Dojo set out to support. This year, Dojo 2 really grew, not just in size, but in spirit. It's reached more people, covered a wider range of biomedical science, and offered more hands-on, flexible learning experience, and over 90 researchers. This is amazing. From across Indonesia, joined 3 mini camps and a 4-day workshop. It's been a journey full of learning, connection, and shared purpose. This wasn't a typical training, it was a dynamic, challenging, and practical. Participants jumped into sparring sessions, applying their skills in research design, genomic analysis, and critical thinking. It was demanding, but also energizing, and a true reflection of the passion in the community. Later today, we'll hear what I'm sure will be a fascinating discussion on the strategies of and multi-holder roles, a vital conversation about building a stronger, more inclusive ecosystem for biomedical research in Indonesia. It's a sign of the growing commitment to collaboration and local leadership. We've already seen progress. Researchers are publishing, teams are analyzing complex data, and a vibrant community is taking shape. Make sure you submit your papers. As a health advisor, a doctor, and someone who works in research, this project means a lot to me, and I'm being serious about that. This is really important to me. I know how much effort, curiosity, and resilience it takes to be a researcher, and I deeply value the role science plays in improving health through this project. We are sharing knowledge and building meaningful connections that can lead to lasting change. The UK is proud to support Indonesia's efforts to strengthen genomics and wider biomedical research. Through shared insights, a genomic gap analysis, and continued support for the Dojo, Indonesia's rich biodiversity and diverse population make a unique setting for research. thanks to the collaboration between the SID, OCRU, GSI Lab, and IMERI, this program has created something truly special. What's been achieved here is just the beginning. The knowledge, the networks, and momentum built are ready to grow beyond today. And now I will ask the participants to stand for me, please. I want to congratulate you, all of you. As I mentioned, I know it's hard. And as you mentioned, you have, as you mentioned, working in research is not easy. You have hierarchies. You need to stand for yourself. You need to know that you don't know everything. And you have to be sure that you can ask questions, because in research, it's important to ask questions. Don't be afraid of that, because I did, and I ask questions to Riff as well, and read all the time. When you are in a new environment, you need to understand that you don't know everything. Am I right? Yes, am I right? Not all the time, but when I speak to my husband, I'm always right. So, as I said, research isn't easy. It's often exhausting and rarely simple, but it matters. It matters for your communities, for Indonesia research future, and for global health. So thank you very much for your commitment, your belief, and in the power of science.
Okay. Thank you, Ms. Julia, for the delightful speech. And by that, we can officially start it, the 2025 Genomics and Science Dojo Dissemination. Please give an applause. Okay, before we start our first panel session, I would like to invite all to the moment of silence so we can pray that today's event will go smoothly and successfully. You can begin praying now. Okay, time the prayer is done. Okay, ladies and gentlemen, we are honored to welcome Dr. Suwarti, also known as Bu Ati, to lead our first panel session. I'm going to introduce Bu Ati first. Well, she is a seasoned scientist currently serving as an associate scientist at OCRU Indonesia, and she has a PhD from Hokkaido University and over a decade of experience in infectious disease and immunology. She has led impactful research that has been published in the Lancet NBMC Infectious Disease, and beyond her laboratory work, she actively supports scientific leadership and training throughout Indonesia. Then today, she will bring her sharp insight and thoughtful guidance as our moderator, ensuring a dynamic and meaningful discussion with our panelists. And please welcome together Dr. Suwarti, also known as Bu Ati. You may sit here.
Thank you, Rona. Assalamualaikum. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. It was not even afternoon, sorry. Good morning, everyone. So thank you, Rona, for such a beautiful introductions. Just letting everyone knows that I was so excited to be part of this community. I was invited by Pa Anu for the first Dojo section last year. It was so at least for the first until the second year, I saw a huge differences, and it is a big applause for the Dojo committee and the steering committee, and even for UK Embassy supporting that. So part of the hardest part in my personal view, the hardest part for me as a researcher is walk the talk. It means that we need to do what we have been trying to say in all of our papers in the real world. One of those are to try to disseminate what we have been done to the public. And I think Dojo gave a very effective model role by having this dissemination exactly after doing the workshop. So it will give a nourish of environment that will bring us notice that we are doing something in this very turmoil, global, political event where you saw mostly negative news everywhere in the whole part of the world. So I'm excited to bring this communications dissemination talk with you. So I will bring many experts regarding this dojo, starting from the government view of how the how our government will lead the way to the point of the role of genomic health to give improving better health for Indonesian citizens especially. So the first section, I will invite our expert from the Balai Besar Binomika, Ibu Iren. So maybe Ibu Iren had something to show, so I will let Ibu Iren first, and then I will invite the other panelists to go on. So Ibu Iren will give a presentation about strategic roadmap for genomic and biomedical research in Indonesia in its future directions. Just a brief course about Ibu Iren, also has the PhD in Japan. Yeah, we are a similar graduate. Not being nepotism or something, sorry. And then now Ibu Iren is the manager of the BGSI lab, and she actively contributed to many researches, both basic researches and also applied research. So without further ado, I will give the time for Ibu Iren.
So I have to set the standard for the speaker. So is it okay here? Okay. 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 So yeah. Okay. So talking about the commitment of the government of Indonesia to transform the health system. So we know that there are health issues regarding the primary care, the secondary care, and also health resources. But now I would like to focus on how the government committed to transform the healthcare from the health technology transformation. So the Ministry of Health also focusing on the information technology and also biotechnology. And here I would like also to focus from the biotechnology aspect for the BGSI. So these are the strategies that the government has applied in terms of regulation, innovation, and also the implementation in the clinical settings. So the Ministry of Health wants to develop inclusive and integrated strategy to support the research and collaboration. So in terms of regulation, we are now still drafting and also in discussion of regulations that related to biotechnology, for example, regarding how to deliver genomic service testing, and also the biobank and biorepository regulation. And also, actually, the focus of researchers is how to deliver the research to be implemented, to be in the in the policies, or also in the product development. And also for the government, we also started with BGSI as the flagship of the program of innovation in biotechnology. We also do the digitalization in terms of information system for biobank, registry, bioinformatics, and also maybe you already heard, and hopefully it's already on your phone, Satu Sehat. And also the strengthening laboratory infrastructure and capacity. And in terms of clinical settings, we are now also established the CRC, the Clinical Research Center, and CRU, Clinical Research Unit, in the hospitals. So basically the CRC will serve to be a matchmaker for also potential collaboration from the external to the clinical research units in Indonesia. Scholarship also for Indonesian talents, and also the inclusion of pharmacogenomic, because you will see later from the BGSI, we also commit to also deliver a result also to the participant directly. And hopefully the aggregate data will be also utilized to develop and to recommend, for example, drugs to the national formulary. Okay, so the BGSI itself is initiated also to address the issue of the genomics that we probably we also know, yeah, the genomics data of even Indonesian people. You can see here the even Southeast Asia, it's not many, let alone to think about Indonesian database. But why the Indonesian database, genomic database is very important for us, because as we know now, manufacturers usually develop the data, develop the product, the drug testing, the drugs and also device kits using population from Europe mostly, because there are the available data. But now we are trying to increase those in order to be able to, so the manufacturers and also research and development can use Indonesian data to actually to have deliver better care for also Indonesian population. And this is why BGSI is established, is to standardize the delivery of genomic service. We also want, through this program, is to enable delivery of evidence-based policies and also implement robust genomic data and infrastructures, and particularly accelerate the innovation by aligning development with clinical needs at hospital. Because I think as a researcher, you also need like infrastructures to enable you to do genomic research. And in Indonesia, it's not, it's quite expensive. So I think, actually the Ministry of Health tried to be able to enable the researchers in Indonesia to actually do genomic research in maybe larger scale, because now we have the shared resources to enable that. Okay, so BGSI is a collaboration between the Balai Besar Biomedis dan Genomika Kesehatan, or Biomedical, and 10 hospitals right now. We are working together to address the issue of health in these diseases: infectious disease, cancer, metabolic disease, genomic disorder, maternal and neonatal health, cardiovascular, brain and neurodegenerative disease, aging, nutrition and wellness, and mental health. So each of these hospitals become the coordinators to do the research and development and also innovation to address these kind of issues using, one of them is genomics technology. So these are the way the Ministry of Health wants to create through BGSI. So the ecosystem that actually inclusive and collaborative for Indonesia. So the hospitals that you already seen is doing the targeted gene panel because they have their interest in those diseases. They collect the samples, and also they will they allocate the samples and send to us, Biomedical, who will do the whole genome sequencing, human whole genome sequencing, because we know that is quite expensive also. So that's why I think this is very important to do the shared resources. So using that, we will also give feedback to the hospitals, the human whole genome database, to be aligned, and then the hospitals can do research and development using the whole genome sequencing data. So on the other side, also we, the Ministry of Health, also the human whole genome sequencing data also can be used for other stakeholders within the Ministry of Health to develop policies. And also this will be, the data also will be available for the university, research centers, and other government agency, pharmaceutical industry, and startups to do innovation, publication, collaboration. But again, this data portal will be secured also. So those who can access the data is those that actually met the criteria. So there should be application, some kind of application, and then we will review it, and then we can grant the access. And these are the roadmap that we are doing for the BGSI program. We now starting from collecting, recruiting the participants from the hospitals. So from specific categories of disease, inclusive criteria. But in this year, we also trying to do the pilot program for general population. So the hubs doing the recruitment for specific criteria of patients, and then BB Biomedical will do for the general population. So hopefully we will have a database that actually comprehensive for patients and also general population. We also, during 2024, we already proved that actually BGSI can actually do this because this phase is proof of concept. We already been able to support the TB national program in terms of providing sequencing services and also integrated health biobank, which connects BB Biomedical and also the hospitals. We also do the human whole genome sequencing with 3 different platforms because we want to be agnostic. We don't want to depend on one or particular platform. And this is also important because BGSI does not end only, the data that not end only in the publication, but hopefully we want to be able to end in launching genomic services in the hospitals. Even in the future, if possible, also for communities, right? Because now we are still focusing on the hospitals. And these are the data that we are collecting. This one is for the clinical data, demographic, and also genomic data. So we hopefully can provide this kind of comprehensive database for the researchers to actually analyze it. And these are the facilities that we have now. So we have a biobank, a tiered biobank with the hospitals and us. We currently store more than 12,000 samples, and then this will be also expanded in the next 5 years. We are targeting to be able to store 10 million tubes. And then these are the samples, 45% male and 55% female participants with the range age of quite big. And also we now store the plasma and Buffy-coat, but there is also potentiality of other samples in the future. But now we are still focusing on storing plasma and Buffy-coat. And these are the NGS machine that we have right now. All of the high throughput is focused only for the human whole genome sequencing analysis. And this, the NextSec and the Minion is now also available for collaboration. So the 3 ones is now running actively every day. And the other one can be open for services or collaboration with other institutes. And also, again, the BGSI program is also supported with development of system information for the data. We collect the metadata, biobank, bioinformatics, and Satudana, the one that will be, with Satudana, the feature that will be available in Satu Sehat. So the participant can have genomic reports, and this can be also accessed by the clinician also by, if the patient or if the participant agrees. So we also develop data security measures. So what I want to say here is that the research is not only for the opportunity of the research regarding the BGSI is not only the lab side, but also actually developing this kind of infrastructure and also analyzing the data, the big data that will be available is also very open for the research here. And these are the core values of our data management principles. So we make sure the data storage is separate. Data security is also our concern, and the integration of and interoperability. We also make sure the user and role management is implemented. So nobody, there's no one that can access everything. So you have to be sorry, I have to time's up. Sorry, and this is if you want to collaborate. These are the terms that non-negotiable. So the data has to be in Indonesia. That is also our main concern. So yeah, I hope this will make you excited as a researcher. So we are the government trying to facilitate you, and you do the good research. Thank you so much.
Thank you, Ibu Iren. Please sit in front of. So I will invite the second panel, Pak Anuraj and Ibu Yuni directly, because I think we're going to have a more interactive sections after this. So silakan Ibu. Okay. So maybe we will start with Pak Anuraj first. I don't need to introduce Pak Anu. Everybody know. I think 270 million people in Indonesia already know Pak Anu. Ya Pak ya? Okay. So we would like to hear about how the dojo have developed all the years. And one of the things that I kind of bit impressed by Pak Anu personally is the way of strategic thinker he is. Sometimes he could be, in my view, he can see the future 20 years further than an average people. So we would like to hear his view about the dojos and the histories of the development. Over to you, Pak Anu.
Yeah, thank you so much. So I think maybe I can share. Anyway, can everybody hear me without the mic, maybe? Okay, great. So maybe just share a couple of stories that I think are interesting. So let me begin by the idea of predicting the future. You raised this. So it's fascinating. So how do biological systems actually perceive into the future and predict their future? So actually the way they do that is by generating diversity by intent. So there's a mutation rate, right? Every organism has this DNA they create. Okay, okay, thank you, sorry, okay. So for predicting the future, biological organisms, they don't really know what's going to happen in the future. So they prepare for the future by creating diversity in their population, because this enables them to be adaptive for anything strange that might happen in the future. So it appears that they might predict the future, but they actually have done that by preparing for all different possibilities that might happen in the future. So this is where diversity in your life, different life skills you have, different skills in data analysis, different skills in scientific thinking, critical thinking, end up being very important. And that allows you to not only predict the future, but to thrive in the future. So that's interesting from a conceptual standpoint. Now, the other thing, I want to tell you an interesting story that is actually the story of the shirt that I'm wearing. So you can see it's blue, and it has a bird on it, sort of bird feathers. And this shirt is actually about the control of a human pathogen, which is malaria. And why is that? So it's an interesting story. It relates to the dojo, in fact. And you can see blue here in the dojo also. I didn't design that, but it just happens to have it. So this shirt, it's indigo colored. So why is that interesting? Because, in fact, during the First World War, as many of you know, the Germans lost the First World War, and they lost their colonies. And so at that time, indigo, as a dye, to dye colored things blue, was very important because the textile industry was really a big industrial issue. So the German government, in one of the first initiatives in the world, decided to make a huge investment in chemical synthesis and innovation. And so they ended up trying to synthesize indigo. And they had some success, but they invented many compounds. And there was an index they created called the Beilstein Index. Some of you who studied organic chemistry may have heard of this. So in one of the failed attempts to create indigo was a white compound, a very stable white compound. And no one knew really what this was. They characterized it chemically. But years later, someone found an insecticide in a plant. And they studied the molecular structure of this, and then they looked at the Beilstein Index. And they said, oh, there's something in the Beilstein Index that looks kind of like this plant insecticide. And they thought maybe this works as well, or maybe better than this insecticide in the plant. So they pulled that compound out on the shelf and they tested it, and this was DDT. DDT, which had the strongest insecticidal power of any molecule I think ever discovered so far. So that was used to control malaria infection. Then this links to another interesting story about the color blue. So many of you know, who's the father of microbiology? Anyone? Koch, thank you so much, yeah. So Robert Koch was very interested in also discovering compounds that could kill bacteria. So malaria is a member of a family called Apicomplexa. And so he observed a compound called methylene blue had efficacy against this. And this was one of the first drugs against malaria, in fact. And so, again, this color blue emerges. And last, also, these bird feathers here. Interestingly, the first organism to be transfected, means transfecting foreign DNA, the genomics, into a malaria parasite, was done in 1993 to a parasite called Plasmodium gallinaceum, which is a bird malaria, and that subsequently led to the ability to do genomic manipulation of the malaria. So what's interesting about that is, in fact, all these three stories, interestingly, they can come together in a shirt that is made on a random basis in a shop. That I walk in there and you can see the diversity of these different things come together and have a meaning and have a power through that story. And so in the dojo as well, it's a fascinating story, actually, the history of the dojo, because actually it originated, I would say, through 4 different things. And this is an example of how innovation occurs and how the future is created also, in a sense. So many years ago, as Ati mentioned, I've been working in Indonesia on and off for a long time, and I observed, not just in Indonesia, but other countries I worked in, that there were challenges for scientists to learn how to produce papers, write papers and so forth, and the skills in data analysis. And my colleagues at Harvard and Johns Hopkins and other schools that I had worked at, they would always feel that these activities, these sort of in-depth analyses, high-quality papers, good quality publications, influential ones, they felt, they didn't say it openly, but they felt that these were really things that only highly trained people with a PhD could do. And science was the property or the business of very sophisticated, highly trained people. And I felt that, well, maybe that's not true. Maybe it's true that you have to have systematic thinking, logical thinking, but everyone, in fact, is a scientist in their daily life, in fact, right? If you're applying systematic thinking for your daily decisions and so forth. So everyone sort of designs experiments on a daily basis. So I thought, in fact, anyone can do science, and I thought, maybe, in fact, any group of intelligent people can get together and work hard and create papers in a short amount of time. And so I wrote a grant for this, and it was called HENRY, the Higher Education Network Ring Initiative. And this was to bring students from Indonesia to Harvard for a summer school course that lasted 6 weeks, I believe, and we would provide a scholarship for this and so forth. And their mission was, in fact, to come there and produce a paper in 6 weeks. And all my colleagues at Harvard said, no, Anuraj, that's ridiculous. No way. It can't happen. Are these all people, they have, PhDs or not? And I said, well, some do, some don't. They said, no way, Anuraj. So, but that was an experiment. So people came over and they were able to produce a manuscript, and many of them got published, in fact. So then someone asked me, they said, oh, this is a really interesting activity, this workshop, this course at Harvard. Maybe this can be a short course. Can this be done maybe in a week? So I said, oh, even I said, oh, that's ridiculous. Come on, a week, come on. And so then, nevertheless, I said, well, let's try it. Maybe we can just do sort of, a workshop activity and so forth. And then a group called Grand Challenges Canada, they funded this because they wanted to train researchers in early childhood development how to utilize the data from their intervention trials to get this published. So in that process, both the experience at Harvard and doing this other workshop that needed to be done, I realized we needed people to teach this course in a short amount of time. You needed sensei that were what I call perspicacious. So a perspicacious person, you can all Google this and look this up. A perspicacious person is essentially someone who is intelligent but is a quick learner. Quick learner to the extent also that they can teach someone else the same. So they're a very curious person, good at absorbing information and so forth. So I realized we needed to search the globe for these perspicacious persons and a sensei. And so I was always on the lookout everywhere I traveled. Could I find such people? And I was in Brazil once, and I found this guy, Daniel Fattori. And I was like, and he was a psychologist and very articulate, very smart guy, could understand everything, could do different data analysis and so forth. And I thought, oh, this guy is really good. We got to get him on to be a sensei, right? That time I didn't call them sensei. I called them peer mentors. So he joined, and then we did a workshop, a 5-day workshop in Dubai. And I realized, oh, we already had identified like 7 persons who I'd worked with over the years. And then Daniel said, oh, I know this guy. His name's Felipe Argolo, if you need another one. And he's also Brazilian. So I was actually out visiting the Summit Institute. And we were going out on a field trip to some island. And I got the phone number for Felipe. And I said, Felipe, you don't know me. This is Anurag Shankar. And he says, and I said, we're doing a workshop for analysis, and we need you in Dubai. So he said, this is like assignment for like, Mission Impossible or something. And he said, and I said, yes. Well, are you going to accept the mission? And he said, yes, I'll be there. So he came there, and so he's a trained psychiatrist. And both Daniel and Felipe practice MMA, mixed martial arts. They're both experts in Brazilian jiu-jitsu. And so we did many workshops over the years, and then I was speaking with them on the phone. And at that time, I had already come here to Indonesia, right? And I was just speaking with scientists, and they would share all their problems, hierarchical issues, difficulty. They hadn't been exposed to different sorts of training quality wasn't good, all these kind of things, right? And so I thought, well, we should do something that helps people not just in the skill set of data analysis and writing, but also this, personal agency and how to be more confident in what you're doing. And my wife, Anita Shankar, actually does research on that topic, that specific topic. So she's one of the few scientists in the world that does randomized controlled trials of interventions to improve personal agency. So she showed me her data on her interventions, and they were so much more impactful than any of the biomedical interventions I had ever done. I realized that I should have been doing whatever she had told me to do, And so anyway, so then I thought, well, can we combine various activities? And I used to think about this. So one day I was speaking with Felipe and Daniel on a Zoom call, and it was about actually, coding, how to do coding for app development. And they said, well, we've made this Dojo activity. And they explained what this Dojo activity was. And it was basically joint code. But it was joint coding in a way that, people could see what you were doing, what coding you were producing, and how to correct it, how to criticize it. And they said, so it's sort of a safe atmosphere. So I thought, that is what we have to do, in fact. for science and create this safe place where people can challenge each other. So actually, within 5 minutes or so, Daniel, Felipe, and I just sort of came up with this idea that we thought this would be interesting. And about 3 weeks later, Zoe got in touch with me, sent me a message and said, hey, Anuraj, we've had discussions with our colleagues at BGSI, so, right? And Zoe said that, there's interest in trying to figure out how to get more outputs from this. And she said, do you have any idea about what could be done? And I said, as a matter of fact, I do have an idea. So I proposed this to her, and she said, oh, that is really interesting. And I said, and actually the Summit Institute for Development is an organization also in Eastern Indonesia that embodies these ideas. Any intelligent person who wants to do something can do something amazing. And so, in fact, their ethos is that we should involve them. And, of course, GSI Lab that had, pioneered a lot of high-throughput genomics here in Indonesia. So that's how it came together, in fact. So a very interesting story of many heterogeneous threads, coming together and thinking how to connect these, right? So life is about that, these random associations, but realizing something is here. And for a short period in time, a door opened. And when that door opened, you have to look through there and see, wow, there's something beautiful out there. I want to walk through that door, and I want to see that happen. And then, ultimately, these things happen actually because many other people believe it can happen and want to create something. So Zoe, she was very forward-thinking. She said, I want to support that. But ultimately, I would say, it was the people who wanted to participate in the dojo itself, all of you, that are part of a co-creation exercise that end up leading to a new process, creating shinjitsu as an intellectual combat sport. It's just an idea until people come together and say, we want to practice this, we want to try this, right? And people saying, I'm willing to be challenged. And then the first dojo, one of the most important things that happen is because there's hierarchies, right? And people you have to be willing to be challenged. Because of that, it's necessary in the practice that people, senior people, are willing to participate and be challenged, right? So, and there were several senior people that came, some people from BGSI, and we have Ahmad Utomo here, who is a senior person. So my hat's off to these people, actually, because they're the ones who said, yes, I'm a senior person, and I'm willing to be in a tournament with other people that are not senior, showing the model for that and the courage for that, right? So that is extremely exciting. So it's all of those efforts, many other people who want to join and innovate. And then this year we introduced the Ninja Run, right? Which was helping people in a short amount of time. Can you write an abstract? Can you analyze data and so forth? So this is sort of the history, the story of how these things evolve. So I think last year we had something like, 40 or 50 participants. This year it was around 100. I think there's been somewhere around, I can't recall, maybe certainly 50 manuscripts completed, somewhere in that area. Most of those submitted, and many of those are published. So this is a paradigm to go through and create outputs. And but the most important output is actually the personal empowerment, the willingness to try new things in science, overcome barriers. As Ariel mentioned, there's a lot more barriers in LMICs. It's easy to succeed in a high-income country, if I can say. It's difficult to succeed in a low-resource arena. So all of you are actually more talented than many high-income country scientists. You might not realize it, but you are, because you're succeeding in a low-resource setting. And so, as I mentioned yesterday, yes, life is unfair, and we can cry and feel bad about how life is unfair, but ultimately what changes things is, in spite of that unfairness, you succeed. And I want to end with a quote from a movie character, which I don't usually quote movie characters, but if those of you who have seen Rocky movies, right? So the third Rocky, anyway, he has this quote, and he says, it's not how hard you hit that's important. It's how hard you can get hit and get up and keep moving ahead. That's how you win. And so that is very important, always to keep that in mind. And all of you are winners because of that.
Thank you, Panu, for such an inspirational thought and journey. So I forgot to highlight what Buiren said. So I think Buiren delivers the availability, although we are in the low resource setting area, but our government noticed about that. So it is up to us whether we want to utilize that and how much we can contribute. And such a highlight from Paano's quote is, the world is there and it is up to you to ask. The first thing first is he's asking Felipe's and Danielle's about everything. So the worst, I always say to the patient, the participant, the worst part for your questions or requests is no. And after that, nothing's fail. So you cannot explore if you don't ask or request, even including when you consider assuming your request is too much. Maybe people will just accept that. So without further ado, we're moving on to the third panelist, which would be not the least, because it will let us know what is actually the NGO's role in this developing dynamic of the genomic things all over the world, and especially in Indonesia. So I will introduce Ibu Yuni Dwi Setiawati. Her experiences in SID, now she is chief CEO of the SID. So Ibu Yuni had a lot of extensive experience and research of NGOs supporting the public health research. So Ibu Yuni will let everyone knows here about how is NGO's role. Ibu, the time is yours.
Thank you. This very amazing talk from Pak Anuraj and Ibu Irene from the government. I think is very supportive towards the the advancing of genomics and science, and also from the scientific community. Also keep the scientists growing through this event, not only event, but we would like to have this platform to keep going. But let me explain a bit about how the role of NGOs in this case, because people may think like NGO, what is that? Is it kind of social work? There's nothing, to do with impact. There's no scientific or research being done. But it's not totally right. Like what we did in Summit Institute for Development, we are not new. We are not doing something novel. But we've been leading the research and development in 25 years now. So it's kind of a quarter century for working with the community. As you can see, all of the things we do is about how to build the community, how to build especially the primary healthcare. Maybe Bu Irene earlier saying that in the genomics, now they are moving forward to integrate how the community can also access the genomic testing or genomics data, and we can use it for research. But we also been doing this since 2000 as a women-led non-profit organization, and that's in underserved setting. In Lombok, in eastern Indonesia, we've been able to keep going with doing research and also benefiting the community at the same time. So by doing that, we've been doing the global and national policy change through the multiple micronutrient supplementation done in 2000 and involved 42,000 pregnant women. And now, just recently, last year, Indonesia just launched that this supplementation should be given as a program for every pregnant woman in Indonesia. So that's quite long, 25 years, 2000 until just recently being launched as a national program. So we keep going with that because that's not only solving just it is. We need to support how it can be utilized for also the pregnant women. So the second one, we are being co-founder of Open Smart Register platform. What is that? Because now Indonesia in 2023 also launched a new initiative in which it is mandated for every primary health care, they need to use data for action. They need to use digitalization. They need to use electronic medical record. But we've been started that through the Open SRP because this is the platform that you can monitor every client, every person in the community, and it's been used by 17 other countries around the world. And the third one is being the founder of the team-based care. So in Indonesia, we have a very strong platform for community health services, which is Puskesmas, Puskesmas Primary Health Center. There's a posyandu, like integrated health post. We also have other clinic based in a village. But how it can, interoperable, how to use data for action, I can explain later. But the core values of the foundation, of the yayasan, of the NGO itself is, from the data-driven, how we can also improve the human resource, how we can community participation as the core. So it's not like you giving benefits passively to the people, but you need to serve them as local actors, as active actors for research and also the improvement in the community. And doing that together with the local community, I think that's the foundation of our organization that bring us into how the role of NGOs in science and genomics and overall biomedical research. So one I can point out is how to accelerate the integration of the genomic testing or the utilization of the data into primary healthcare setting. Because we would like the genomics in for all, not just specific person who can pay for it, but it's for everybody. Because in some of the community, they may have some, like Pak Anraj mentioned, biodiversity in their genomics and genes that we don't know. But they don't test it because they don't know, and there's no access in the primary health center. So we would like to have this genomics to be for all, not leaving anyone behind. And having the precision public health is being emerging now. Is many people saying that how to be, precision in public health, how to make intervention a specific population, not specific individual, but specific population in a right time. And how we can also integrate the impact. Like we do research, we collect data, we don't just extractively using that data, right, from the community. But at the same time, you need to think about how to create benefits. So integrating that into primary health center, into the routine care, it will bring about direct impact to the community. So that is the thing that we also doing daily basis in our organization. And research for action, I think this is also important, doing something translational research into a real world experience so people can directly also have that, benefits. And enhancing the knowledge output, of course, this is one thing that you all also being your goal is to have publication. But long story short, of course, this is embracing the genomics. It has like multiple skill set need to be in the table, but we also need to have like data collection in the routine care. It can be a big data, and big data not only extractively for research, but also right away how we can utilize it for the community benefits. So what we do is creating this kind of ecosystem as digitalization now being utilized by the government to improve the health services. So we also have this person-centered primary health care. As I mentioned earlier, we do have like primary settings in multiple facilities. There is posyandu, integrated primary health care. There is a puskesmas. There are also clinic and whatever in the villages. But as you can see, what our ideal goal is here. You can see the family, you can see the family in the center. That's the ideal situation where everyone in the facilities is able to find what is the gap in care in this family or even individual member in the family. So we need to make the data interoperable, right? Whatever is data collected by the doctor or by the midwife, it can be known or it can be accessed or it can be notified to the carer or the community services, community volunteers, and also the most important like a midwife who have serving pregnant women from the beginning until the baby is born. So how we can utilize that available routine care in primary health center can be utilized for creating impact in the health and also addressing also inequity issue. So it doesn't matter where the person are, they need to be able to use their data and access whatever they usually access in the routine care. And the data can be used not only for reporting there, okay, this is completed, this is not completed, but this is the care plan that you need to do next. And how to enable that actually we create that platforms, multiple tools that used by the community to enable individual data can be connected for multiple services and multiple platforms. So the data being in the server in the middle. And this server is not national actually, but locally owned by the government in the district, because it can come back to the community very fast. Of course, the Satu Sehat is a very good foundation, and we are using the same standard as the Satu Sehat. But now the problem is how Puskesmas, how the village head can know what kind of data, what can happen in my community. Is it my pregnant woman healthy? Is it my neighborhood is healthy or safe or sound? No one know that. No one know that until we make the data visible. So by doing that, this is kind of follow-up services that we are trying to address as well. Not only from like I say a dashboard, it can be seen by the village head, by the Puskesmas head, but it also can be used for preparedness. Let's say in Posyandu, what doctors should be bring, what community health volunteers like cadres should prepare before starting the Posyandu. Otherwise, people may not come because they see like, oh, it's not complete and so on. And you can also see from the data integration, because multiple source of data in the community, a lot. There's a lot, but sometimes it's just keep in that specific storage, but never been used. So we are trying to make it visible and can be accessed through multiple level of access, given not everyone have access. Of course, a specific access, but also the one most important, also the one below, when we enable the end-to-end services. You get the data from the, let's say, pregnant woman. They need to know what has been done through their data. At least you mentioned like, hello, this is your care plan. This is still missing. Please come to the Puskesmas. Please come to visit your Posyandu or integrated health post. Please see your midwife, because this is not yet done. And make sure, how are you doing today, and so on. So make a reminders, education given right away in the phone of the pregnant woman. Or if you cannot find their phone numbers, go to visit them. Because the human-to-human interaction is still like important in rural settings. You may not expect they are having internet access or even electricity, but you still can visit them in their house. So we are integrating all of this ecosystem to enable not only get data from the community, but right away you provide benefits as well. So make sure in every research you do, you have direct benefit. And this is some examples, that 4 things that I mentioned earlier, how we enable the research into the work settings improvement, and also have the publication on knowledge products. I think that's what I will mention about our role in NGO. It's not only just doing social work or something not having no impact. Of course, we are key partners that you can work with to enable how community can get benefit and improve also the way we can improve the health of the community, not because they are living in a certain area, but genomics for all and research for all in improving their real-world setting health. I think that's very important. Thank you.
Thank you. Big applause to Ibu Yuni. That was such extensive examples on how the NGO's role in doing the research and the genomic research itself. So, wow. I even haven't stated anything yet, but some hands are raises. It was so excited to see somebody who is very excited. So now is the Q&A sessions. Since your hands are first.
Thank you very much for this opportunity. Okay, my name is Ria. I'm teaching assistant. Okay, I have one question for every panelist. Is it okay? Okay. This is first for Dr. Irene. My question is, how can regional collaboration in genomics, especially through ASEAN, because Indonesia, one of the member states of ASEAN, accelerate our preparedness for emerging health threats and ensure equitable access to genomic technologies across member states? And the second question is for Dr. Anuraj. What are the most critical priorities that should define the roadmap for genomic and biomedical research in the next decade to ensure regional resilience innovation leadership? And the last questions for Dr. Yuni. How can we integrate AI and genomics responsible to deliver precision medicine in low resource settings? Thank you very much.
Thank you. So the first question, Ibu Iren.
Okay, so full disclosure, I'm not involved in the discussion of that, but I think I know about the ACPCHEED APCHET, yeah. Yeah. So there is a initiative in doing like I think it's like to I'm sorry, I lost the words. For the health for the preparedness and pandemic preparedness and response. I think there is a initiative in that. But if in terms of precision medicine, we are actually now drafting the concept and trying to reach out for the ASEAN Secretariat because we know that there are other countries in ASEAN like Singapore, Thailand, also Vietnam, already also doing the similar initiative like us in Indonesia. So there is a plan to talk about it, how to actually integrate, because we know we want to develop the Indonesian genomic database, but also other countries, ASEAN countries, also doing the same. So how do we actually integrate this, and then maybe we can learn from each other countries on how to actually implement this this knowledge and this this research and innovation in terms of genomics and biomedical theme to particular to healthcare services. So yeah, I think I can answer right now. Hopefully it will we're trying to manifest that for this year. But again, will be led by the for Indonesia, led by Ministry of Health in terms of health sectors. I hope that answers your question.
Okay, maybe moving on to the next questions to Pak Anuraj, perhaps.
Yeah, so that was a very interesting question. So the question was, what is necessary? What's the direction? Where is genomics going in the future, and so forth? Yeah. So that's a very good question. I think that I think that the idea that was articulated by Ibu Irene on this BGSI is, enabling genomics for all, and also mentioned by Ibu Huni about how important it is for genomics to have a role, not just for persons who might be sick in some way, identifying a mutation or something, but in fact everyone can benefit from genomics. So I think a part of the future is really making sure that genomic services can be reduced in cost and be made very efficient and be a normal part of everyone's healthcare. So I think that's the first thing. And so all the informatics around that, the genomic pipelines of processing of all that is extremely important. So building the infrastructure for that. And I think that's where BGSI has been really innovative and forward-thinking in that. And also some of the informatics pipelines for that and creating these high throughput workflows in genomics are very important. And I think in Indonesia, that's where you see GSI Lab as an innovator. They're the ones who really, during the pandemic, were the first to really create high throughput molecular diagnostics and sequencing and brought the price down tremendously. And that helped catalyze a huge change in the genomics in Indonesia, and actually helped inspire BGSI Lab as well, because the health minister used to come over to GSI and say, "Oh, this is so amazing. We should be doing this in the Ministry of Health." And he was right, and he did it. It's fantastic. So, and then if I think, well, beyond genomics, actually to give it value, it's not genomics alone. It's actually genomics integrated with many other things. And this is the important thing. So if you look at the attributable fraction of genomics to a disease condition at the level of the population, typically the attributable fraction is not high. And usually, actually, it's the social conditions that are very important, having a much larger influence. Now, this is different from the level of genomics impact on an individual, because the real heterogeneity from a genomics perspective is not actually the heterogeneity between two different populations, but it's the heterogeneity between any two individuals. So what this means is that we have to bring together both the heterogeneity in the genomics at the individual, certainly with the social science aspects and what's going on from a cultural context, and also certainly from the population genomics level, because there the attributable fraction already from genomics in terms of the heterogeneity between different populations is not that high. So it means there the interaction between genomics and the society, the social aspects, the cultural aspects is probably more important. So being able to capture that, these two together. So the future will be around that. And lastly, I would say the tools, genomics is a field of science. One of the things they've done, which is really outstanding, is they have applied innovative algorithms for discovery of patterns in DNA sequences and cluster patterns and various high throughput data pipelines that are highly efficient. They have created these because of the large amounts of genomic information, AT, GC, so many sequences over and over again. Now, those tools integrated and applied to social science and culture at scale, that's what would be interesting. So if you think about the human organism, right? So actually in the human organism, although we may think of it that it's us as individuals, it's actually all of us together. And the real human organism is in fact, it's the culture that we create. So the superorganism of humans is that. It's the culture, in fact. But what is the DNA of culture? So this has not really been discovered. So what is the ATGC that is put together that enables a culture to function and to perpetuate, right? Because there's cultural transmission. So I think this is where many of the tools in genomic science applied to other fields, like social science, would be extremely useful. So not only integrating genomics and social science, but in fact integrating the tools, introducing the tools for genomics into other areas of investigation. Understanding what is culture, how do you, what's the DNA of that? How do you discover that, right? How do you change that? These are the things that are going to be extremely important. And so I would say the future is really around those things. Over. Absolutely, absolutely. We have to be interoperable, not just in data, but we have to be interoperable in thinking. Yeah, yeah, yeah.
Yeah, that's also an interesting question about how you utilizing AI now become a tools that can be utilized also in community, how they can use it. So just we also received some support from the Australian government just recently to integrate AI in healthcare. And one of the use case of that actually, we're trying to answer, so you know the pink book, the buku kaya. The buku kaya is held by every pregnant woman, by every baby born. But it's they have a lot of data inside, but it's never been able to not extracting, but utilize it for integrate with other routine data that is collected in the Puskesmas or in the Posyandu. So we are trying to enabling that source of data to be interoperable with the pink book. But again, we find this opportunity because we interact more with, looking at the real world. This has been utilized, the book is being held, but it's sometimes broken, it's lost, the data being lost. So we're trying to use AI to enable that source of data be integrated with other data being collected routinely in the primary center. So I think the opportunity is that the more you work with the community, the more you find opportunity to help them to not only use data for, get the data from them, but also let them define what actually you need. And we found this is the need. They need not only from us, but from the community. Then we're trying to get support and then the program is then running now. And I think this is now becomes the interest from the government as well, how to make this is into digital things, the Kaya book. But I don't think it's not the answer yet. We need to find the flow. We need to find how we can also help, the community from making it integrated with AI. Yeah, that's my response for your question.
I was midwife before I become teaching assistant, so I really know about your condition. But for that, because we are in diversity social economy background, I know it, but I really want to know about from MOH, Minister of Health, about this collaboration and responsibility for every single person in Indonesia know about the integration, the AI, for the especially in genomics. Thank you.
So how does government strategies of using this integrated data that have been collected?
This is a big question for just me, manager
Luckily,
of BGSI
I'm not part
program.
of the government, and I'm not the manager of BGSI.
Because BGSI program does not focus on that, but what I know, so because BGSI is only like technical unit, so if you ask me about the strategy for the using integration of the data, what I know is that the big idea is to use the Satu Sehat to actually to integrate all of these things. But I think there is in order to implement that, we still have some challenges to do that. But I think even for the big dream is that the Satu Sehat can be like integrated. Like for now, maybe the NGOs and other stakeholders already developed the application for the health community, and then the Ministry of Health is trying to integrate that in the one system of national health system information. Yeah. So that's what I'm sorry I cannot fulfill your.
Sure. Well, one step.
That's
at a
what I
time.
know.
Yeah. One step at a time. Okay. Okay. There's like we will have another. So I have my backup questions here, but I wouldn't use it. I think so. The next questions is from Dr. Apin, and then
Thank you. My name is Arif Yanto. I'm a pediatrician in a district hospital in Jakarta, East Jakarta, RSUD Pasar Rebo. I have questions to Ibu Iren and Ibu Yuni. Sorry for not asking. Pak Nuraj. Bu Iren. My question is, how can we be involved in all the ideas from the BGSI? Because as far as I know, in reality, I see two stratification. There are hospitals owned by the government, or we call it vertical hospital, and the hospitals owned by the local government, like in my hospital. I just knew some new things from you. So I think, is it quite exclusive from the Ministry of Health for doing so many new ideas that is very valuable if all of the hospitals can be involved in this project, especially in genomic. Like for example, I've been working a lot with patients with tuberculosis, and this is the issue that you just mentioned in your slide. Also, as a pediatrician, I face many children with stunting and such child health issues. So this is very interesting, and you need many participants. So my question is it exclusively for only hospitals owned by the government, or can we be involved? Because I think it's very interesting and very valuable for our patients. And the second is to Ibu Yuni. I'm very interested with your role in NGO. even though myself is a clinician, working for patients, not working mostly with public health issues, but I cannot deny that I face many public health issues every day. I have patients with tuberculosis from the low middle income people, and we know that we cannot stop the spread of the infection if we only focus on the patient only. We have to see where they live, where they get the infections, and it really needs collaboration with primary health centers like the Puskesmas. Also, I have in Jakarta, we still have many undernourished children. Some of them are severe malnutrition, and some of my patients, because I'm a pediatric neurologist, I have so many patients with cerebral palsy, and most of them have problem with malnutrition, and we always have new patients every day, every week, and I think it will not be finished if we don't make good collaboration with the primary health care. We do, but I think the innovative made by the primary health care, by the government, by the Dinas Kesehatan is not enough. Maybe they have lots of funding for giving formula milk for stunting children, but it will not finish the problem. That's not the core problem. So how can we get advice from you, or maybe we can make collaboration in the future by breaking barriers between the NGO and the government hospital, so we will finish the problem. I think for many years it's not solved. We don't. It's not enough to have initiative from the government. We have to ask help from the NGO, even local NGO that has many experience. You should share your success story, and you should spread it with us. How can we have that insights and we have collaboration with you? That's all my questions. Thank you.
Thank you, Dr. Min. We will have the questions first, and we will move on to the next.
Okay, so the reason why it started with the 10 hospitals, doesn't mean that it's not meant to be exclusive, but it's more than because it's a project at first, the pilot project at first. So we want to see whether it's actually feasible to do it. But then these hospitals can actually create network, just like in TB, the hub for the infectious disease, actually creating collaborating with other local hospitals also in terms of being a satellite. So they recruit through local hospitals also. So if you are interested in collaborating with one of these hospitals, you can reach out with the hospitals and then say to them that, hey, I would like to participate with your project. Or you can also reach us and we can connect you with them. As long as if you have the interest in those topics, feel free, because I think this program cannot be successful only with 10 hospitals, because as you see in the roadmap, we want to make a large database for Indonesian population genome. So it takes a lot of participation from other hospitals. So it's not exclusive for those hospitals, but you are also welcome. And the reason why we want to come here and disseminate is please come join with this initiative, so it can really become very valuable for the program of the Ministry of Health and for the Indonesian people. Thank you.
Now the door is open.
Contact me after this.
Yeah.
Yeah, thank you, Dr. Apin, for that great question. I think this becomes our long-term problem as well. We are trying to help on, it's quite, I could identify might be 2 or 3 problems there. First, we know that primary health care is not connected well with the,
secondary facilities like hospital. So once the patient coming to the hospital, we need to repeat again what kind of service you receive in the hospital. When someone also referred to the hospital, they will also be asked again what you have been get from the primary health center, from the posyandu, and so on. So I think that's the big idea of Satu Sehat, which is we also support the government initiative on having interoperability platform like Satu Sehat. But then again, the main goal now is to make the district or the local partners know that when the data visible, they can take action faster. This data is not also about aggregate data, but individual patient data that they can follow up if they find, in this specific village, I found 2 person, let's say, with the low birth weight. So they can take follow-up, right? And the follow-up is not necessarily from the puskesmas. It can be also engaged with the village, the head of the village, because they also have funds, have funds to, kind of increasing the population health. And stunting also can be, solved, can be not continuing to progressing if we find the low birth weight as early as possible. And most important is to make, as you as midwife, make the antenatal care completed and in high quality. Because there are like 12 indicators that you need to measure within the 9 months or 42 weeks of the pregnancy, or 39 weeks of pregnancy. You need to follow up what kind of visit, what kind of services this mother receiving. Every single mother, not like many mothers, but every single mother, you need to monitor them well. If there is a gap, you need to remind them, you need to educate them, whatever the flow is. But we usually find that 3 things, like using the technology is important. The second one is having end-to-end services, like enable us to reach out to the families also, and doing home visit if you find nobody can be, reach out through technology. So I think this flow need to be, monitored as well. Then I think the third one is making sure everyone in the puskesmas or in the district or even in the higher level not treating data only for reporting. Because they only fill out their report once a month. But the gaps is actually happen every day, but no one notice until you open your report monthly. So I think that's also the cultural change in the way data is utilized. Need to keep pushing forward. We may need to train the people. We need to we provide them with everything, but if the data is not treated as something powerful tools for decision making, they just end up monthly report and something. So I think that 3 things. Of course, we are happy to collaborate, and we usually collaborating with the governor, with the district health office, even the hospital as well, to make whatever is possible for improving the community health.
Thank you, Ibu Yuni. The next questions. We will come under the next term. Okay, maybe we only have 5 minutes, so please shorten into 1 questions to one participants. Thank you.
Okay, thank you. My name is Ratri. I'm from Sleman Health and Demographic Surveillance System. I'm interesting to, I have a question for Dr. Iren and Dr. Yuni. I'm sorry, Dr. Anuj. So, as an independent scientist, like research, we often come up with challenge accessing high quality data, especially for population. As you mentioned, Dr. Iren and Dr. Yuni, you have those resources. Is it possible to ask from the independent scientists to access those data and collaborate with you to provide some maybe scientific evidence-based discovery that we can deliver to the stakeholders? And maybe if it's not possible to access the data, is there any others alternative so we can also contribute to this initiative? Thank you.
Thank you.
So in terms of accessing of the data, we have the long-term and also the short-term development. So for the short-term, for independent scientists, I think it is, I would advise you to reach out the hospitals, the hubs that becomes the hubs of BGSI, because I think they also need people, scientists, also to help them to curate and also analyze their data in the hospitals hubs. And also because they are the ones that can access directly, because they're the ones that contribute of the BGSI program, so they can access also the human whole genome sequencing and the database that they already contribute. So you can actually can contact them and then have a collaboration with them and use the data and analyze that. In the longer term, we also now is still in the development phase, that we also developed the some kind of trusted research environment, so data portal, so any scientist, particularly for Indonesian scientists, can actually access them but you have to like say to us like what kind of data you want to, because we don't open everything for everyone, so you have to know first what do you want to do, what kind of data you want to use, and then we can review and then we can give you. But that's on the longer term. In short term, I would advise you to contact the hospitals, because the hospitals does not only collaborate with other hospitals but also the universities, and research institutes. So there already been collaboration on that, so you can contact them.
There are huge participations of many stakeholders behind that, so we need to.
That's not only one
we
institute
need to give
work,
acknowledgement to everyone as well.
Yes.
Okay. Now, maybe we had another opinion.
Yeah, I think that's a really good question as well. So, whatever the regulation on data that Indonesian Ministry of Health or Indonesian regulations say, we follow that. In this case, if that data patient, of course, that's owned by the patient, so we cannot, just share it. But we also build the connection or build the kind of partnership with the local government, and they will very helpful to have kind of collaboration with NGO or other scientists to, I think, follow up from that insight in the data, patient data. It can be utilized for research as well and gain insight, as you mentioned, like policy brief and others. That's possible, so long that you make, specific affiliation. Let's say if in the government, in the local government, they usually need to have MOU like NDA as well, and it's locally, the local governments and the governance, data governance in local usually been more, easier to not access, like utilize for follow up insight. That's how I would say. Yeah.
Oh, Panu wants to answer and give opinion.
No, I just wanted to say something else, okay. Which is that, this was a great session, but I just wanted to mention to people that the reason why we're here, actually, this location, you might ask, well, why are we here, okay, in this particular place? And the reason is actually, this is a creative community. This is an artist area, this, Taman, Ismail, Marzuki Park. And so we were looking for a place maybe where the dojo could be part of a creative, inspirational community. So actually this room, this facility here, this will be the future home of the dojo. Do you know what's inside? Dojo, yes. Yeah, so you have these two rooms over here will be the Shinjitsu arenas where you will, have your competitions and so forth, and there will be a regular program of activity here as well. And I think what's important is there's a lot of enrichment of this community overall, is a creative community, and being interoperable in the skills also. So yesterday, in fact, I think one of the activities was to do innovation with clay sculptures, and a lot of you went over there and were doing that. But yeah, I just wanted to announce that.
Great. Fascinating. So we will have two more questions, I think. Yeah.
Thank you, moderator, for taking my question. My name is Victor. Could I address my question to Mr. Sanggar? I'm going to touch on regulation, sir. Doesn't there have to be a lawful basis when it comes to genomics? I mean, in each country and each jurisdiction has its own issue about law. I mean, in terms of data. Could you please fill me in on that? I mean, what best practice is happening now in British or UK when it comes to genomic and the rule of law, data protection? Thank you.
Yeah, that's a very good question. So I think many of the concepts outlined by Ibu Irene about that the BJSI group is doing are very important. And these have to do with separation of genomic data from other data, anonymization and encryption of that information, and then authorization, so opting in. So there must be a patient authorization that, yes, I consent actually to having my genomic information created, and being able to also opt out of that at any time. And so I think really the core issue around this is maintaining protected systems, trusted environments, and they're actually enforced. There must be auditing of this. That's extremely important, because most of the systems that are insecure, it's actually not because of the design of the system, it's because the human beings who are implementing them or practicing them don't do it correct. Like, how often has it been that people will share their password, for example, right, or something like that? So those are sort of the insecurities that end up occurring. But anyway, having the system designed well, and then the other key principle I mentioned is the ethics of the consent. So this is extremely important, I think, yeah. So I would say those two things, if those were by law and enforced, are very important. And they've done something else in BGSI and SID as well, which is really exciting. They have really both carefully enforced the idea that all data must be stored and used in country. Doesn't get sent out. And I would really big applause for these two organizations that have really promoted that here. Yeah.
Okay, thank you. One more questions.
I want to ask to Bu Iren. So I think it's a follow-up questions from Mbak Ratio over there. And the question is, will be opened the consensus frequency of or the genetical profile of the Indonesia, as well as we can access openly the NCBI or ensembles, because I think it's very important for us as a researcher. I'm a genetician, and to put into perspective, in Thailand, I'm from Chulalongkorn University, and we have the same things, because I think it's related with what Anurat said, that heterogeneity is a very important for us in Q1 to deepen in the genetics, because major frequency between the population could be different. So if we don't have the consensus genetical profile in the certain population, it would be biased. We thought it will be a mutation, but perhaps it's not a mutation. It's a major frequency in that kind of population. So I think will be like that in the near futures, because if we have to come directly to the university or to the hospital to asking, it will be very, it will be very bureaucratically, and also could be not integrated. For example, like now NCBI and Ensemble now integrating their data, making an MANE, because they have a different data set, right? But they're trying to collaborate it to make a new data set called MANE. And I think it's a very useful for us, because in the best practice, usually if we use NCBI, we need to precisely say, oh, this is our reference for a genetical profile or something. But since we have a MANE like now, then we can have a same standardized genetic. So I think that's my question. Thank you.
Yeah, I think that is also important part, yeah, because the next homework for us is not only just collecting and generating data, but actually standardize the data and the quality of the data. So in for now, we are still in the process of ensure the quality of the data is reliable. So I think that your point is also important for us for the next step, yeah, to actually to think about how about the consensus of the data, the genomic data. Thank you.
Okay. Another highlight is that we are a huge populations with with a very diverse geographical settings and ethnicity. So the genome lies behind there, probably unique and requires a lot of effort to be developed. I think this is also one of the challenges as well as a modality for becoming a bigger genomic thinking in the futures. So unfortunately, we don't have that much time, but give us a huge applause for the very fascinating panelists in front. And thank you so much for all of your participations. Again, you are here as a champions that you're contributing a lot to this new knowledge built in our environment. And that will be the end of these sessions. Thank you, and I will give it back to the Rona. Thank you.
Okay, thank you for all the panelists. Before before we ended this first panel session, we are going to give you a plaque for all the panelists and then I will need the assistant of Yulia for giving the plaque for each panelist. So for Miss Uni, Miss Dr. Irene and Mr. Andras, can you please stand in the front? Okay, first we are going to give the plaque to Dr. Irene. So, can you give it to? Okay. Then we are going to have a little moment of documentation. Okay. Okay, can you please look to the camera? 1, 2, 3. Not least for Mr. Shankar. Oh. Okay, shaking hands and then look to the camera. 1, 2, 3. Okay, can all the panelists take a picture together with Miss Yuni and Guati? Okay. I'm going to take the picture. Okay, give an applause for everyone. And that concludes, so you can go back to your seat. Okay, that concludes our first session. And we are going straight to the next second panel session. And I would like to invite again Guati to the front of the stage. We are going to disclose on how the participant involved in this program, Genomics and Science Dojo, during their mini camp until grand tournament. So without further ado, let's give an applause again for Bu Ati.
I hope everybody is not getting bored with me. So we will now, after those inspiring sessions, moving on to what is happening really in this Genomic and Science Dojo 2.0 this year. So we would like to invite the winners of the grand tournaments from the Genomic and Science Dojo. Our first opportunity, I think it's coming from, we are happy to announce that this time the first winner of the tournament, we have our foreigners friend that already been staying here to pursue her PhD.
So I would like to invite Nuha to present about her materials during the Genomic and Science Dojo.
بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. First of all, I would thank Genomic and Science Dojo for giving us this opportunity to present our research titled Gender Disparity in Depressive Symptoms and its Determinant among Youth in Indonesia, finding from IFLS data. It's not... Yeah, what about now? Okay, Nuha Al-Aghbari with my colleague Sylvia. So, globally, mental health is a public health issue that impacts people in all ages, especially in low and middle income countries. And depression is one of the primary causes of disability and death. So, according to the WHO in 2023, the depressions affect 280 million people worldwide. 4% were male and 6% were female. So what is going on in 2030? They estimated that depressions will be the most prevalent incapacitating illness worldwide. In Indonesia, according to the SKI, the prevalence of the depressions in 2023 is 1.4, and Indonesia ranked the 5th country from the South Asia, as we can see here. What is the obstacles that lack the mental health systems like service? The first of all, lack of funding, low of the insufficient healthcare professional, stigma, low and educations and awareness related to these depressions. From the previous research, many research showed that there is a what is the determinant that is related with the depressive symptoms. However, there is a notable gap between the genders. What are the factors that affect them? So our study aims to examine the determinants of the depressive symptoms among Indonesian youth, focusing on the gender difference. This is the methodology. So our study is a cross-sectional study using IFLS data. IFLS data is a secondary data which is established in 1993. So in Indonesia, you have a secondary data which has 5 waves. So we use the fifth waves. It covers 83% of the Indonesian population. So the research subject in our study, we targeted those between age 15 till 24, the youth according to the WHO definition. And then we start to collect the data by clicking to this link, downloading the data. After we download the data, we merge the data, coding, cleaning the data. After that, we did some things which we have learned from Dojo, which is weighting. Weighting, we will find slightly different in our result comparing to the previous one. What is going on? We did data weighting. After we did data weighting, PCA analysis, and then we start to do our analysis, which is bivariate, multivariate analysis. After we exclude all our exclusion criteria, so the total sample size was 6,522. This is the skills that the survey used during the assessment of the depressive symptoms. Our results show that Table 1 explained that the bivariate result, which showed that male has a slightly higher depressive symptoms compared to the male. What about the multivariate analysis? The multivariate analysis, the factor showed that the similarity between male and the female who are unmarried, reported unhealthy, and lastly, who reported who are unsatisfied with their life. And what about the factors that affect only male who reported who are currently smoking? And what about female? The female who reported who were former smoker and who were having comorbidity, either one or more than two comorbidity. So we conclude that the study concluded that depressive symptoms are common among both gender, but with slightly higher among male. So our focus contribute to the depressions differ by gender, indicating the need for the gender-sensitive mental health strategy. So for the male, we recommend that anti-smoking camp, youth-oriented service such as vocational training center, sport club, and workplace. However, for the female, it is critical to integrate mental health care into the chronic disease management for the young woman by developing gender response to the health system. These are my reference. Thank you.
Thank you, Nuha. Thank you, Nuha. I forgot to mention that Nuha is currently pursuing PhD in Universitas 11 Maret, right? And you are former lecturers so you are Yemen nationalities, and then you pursue your master's in India in public health. So you're traveling around the world to get the knowledge. And you're here with your colleague, Sylvia. I will introduce Sylvia also to everyone, please.
Hello, everybody. Good morning. I'm Sylvia Samuel Lugeleka from Tanzania. I'm studying with Nuha in Universitas 11 Maret, and I did my bachelor's in India. I'm glad to be here. I learned a lot from everybody. You're good researchers, and thank you so much to the sensees and the supervisors. Thank you.
Thank you. Give applause to Nuha and Sylvia, and congratulations to
thank you so much.
Be the first winners of the Genomic Science Dojo 2.0. Moving on to, okay, you can come to your seats again, Nuha. Maybe we will have another later sessions for Q&A. The next is we have social influencers with us. This is the second winners of the Genomic Science Dojo. Everybody knows him as Dr. Apin, and he is generated in Universitas YRC, which also the second winner of the first Science Dojo. I don't know, maybe Pak Ahmad had another specific curriculum for developing Genomic Science Dojo winner. You can ask. So I will invite Dr. Apin to deliver his research about, and you might also to introduce your partner during this Science Dojo. Thank you.
Thank you. Thank you, Bu Ati, for the introduction. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Let me introduce myself. My name is Arif Yanto. I'm a pediatrician. I'm a pediatric neurology consultant in RSUD Pasar Rebo Hospital in East Jakarta. I'm sorry, my partner is not available to be here right now. My partner, also my spouse, my wife. And for your information, I just knew that Pak Ahmad was here in the Shinjitsu because we never made any appointment here in the dojo. But I'm fortunate to have Pak Ahmad here. Okay, this is the presentation that we had in the cycle and the Shinjitsu. It's cognitive and behavioral comorbidities in children with Rolandic epilepsy. There are so many kinds of epilepsy in children. We don't mention epilepsy in adult, and we call them epileptic syndromes. One of the syndromes is called Rolandic epilepsy, and the terminology for some syndrome has always changed for years. Like this Rolandic, now if we try to search in literature like PubMed, we will find the newest terminology is self-limited epilepsy with centrotemporal spikes. Previously, it was called benign epilepsy with centrotemporal spike. Although it was named self-limited, also benign, in nature, in fact, it is not 100% benign, even though almost are self-limited. About 15 to 30% of children with this epilepsy syndrome experience cognitive and behavioral impairment. So the objective of our study was to examine the cognitive and behavioral comorbidities in children with Rolandic epilepsy. So we can predict better in the outcome and the prognosis in the future. It was a cross-sectional study. It was done in 9 locations during the pandemic in 2020. And the inclusion criteria was children aged 6 to 12 years of age with Rolandic epilepsy based on clinical findings and also the electroencephalography findings. We could not make the diagnosis of Rolandic epilepsy if we didn't undergo the EEG. So it is we had to do the EEG, and we exclude children with in this exclusion criteria, especially those who had comorbidities like cerebral palsy. And this is the diagram. We had the total of 34 subjects, even it's maybe quite minimal sample subject, but we had fulfilled the criteria from the calculation we had. And we also have the help from a senior consultant in pediatric neurology. They reviewed the EEG, and the IQ testing was conducted using the help of a psychologist. And this was the result of our study. Most of the children was 6 to 12 years old, and we also tried to find the predominant source of the epileptiform waves. We have 2 brain hemispheres, the right and the left, and we also tried to make a simple statistic analysis, and we had no statistically significant relationship between the age of seizure onset and the cognitive or behavioral comorbidities. And we also didn't find statistically significant relationship between the number of hemisphere and also with the cognitive and also the behavior comorbidities. We tried to find children with autism spectrum disorder and attention deficit hyperactivity disorder as the comorbidities in behavior. So the conclusion of our study was, although this kind of epilepsy is mostly considered as self-limiting and benign, but we still have some cognitive and behavioral comorbidities in those patients. Although the relationship between variables are not statistically significant, we still have to monitor the cognitive and behavioral comorbidities during the treatment of these epilepsy patients. Thank you.
Thank you, Dr. Apin. So, to make it a more active discussions, I wouldn't take a long time to invite the 3rd winners. Where is Nurma? Oh, okay. I will invite Nurma to present her works and the team. Please, Nurma, the time is yours.
Okay, first of all, I want to say thank you for people to come here, and I want to say thank you for the dojo, so for giving me an opportunity to showcasing my research or our research findings here. Okay, so a disclaimer, I'm actually not the 3rd winners, so the 3rd winners couldn't come here, so I have to substitute, and I'm the 4th or 5th. Also, okay, so I would like to introduce myself. My name is Nurma. I'm working in Summit Institute for Development, and also my colleagues, Carl Dalton. He is from our crew. And so this is our research, a spatial temporal and risk factors analysis for drug-resistant TB in West Java from 2020 to 2022. Okay. Okay, we all know that Indonesia is one of the countries with the highest TB burden in the world, the second after India. And West Java itself is the highest number of TB cases in Indonesia. So that's why it's really concerning that the tuberculosis in West Java is really high, and we want to see how the distributions of the cases of TB burdens and how that would affect from one region to other region. So we want to see the patterns. And the geospatials, we're trying to find out, because this is still a lack of the evidence on how the geospatials and TB study and also the risk factors for DR TB in Indonesia, especially in large data sets in West Java. It's still limited. Okay, so the data source, we gather data from the national TB surveillance systems as the secondary data, and we do the cohort retrospective study. So we are analyzing the data from the secondary health data, and we collect around 300,000 data set of the TB cases, and we already clean the data, and we exclude the data with the people who treated outside of West Java. The data missing we already clean, and the 300,000 is the clean data we used and we analyzed. And also there are around 3,600 patients TB with drug resistance. And first, I want to explain the three things that we are assessing in this study. First of all, we want to see the trends on how the TB cases from year to year, from 2020 to 2022. And also the second one, we want to see the special patterns of the TB spreading or TB distributions in West Java. And the third one, we want to see the risk factors of how the TB factors are affecting for the RTB in West Java. And there are variables that we are trying to assess here in our study. The first one is age, gender, domicile, treatment history, HIV, co-infections, diabetes, mellitus, comorbidities, occupations, treating facility, and date of treatment starts. Maybe I would like to explain a little bit about the statistical analysis we use. So we use data for Poisson regression to see the risk factors analysis, and also for the geospatials we use a quantum gist to see the spatial temporal analysis on how to distribute and how the also correlations in these cases in West Java. Okay, so this is the result from 2020 to 2022 of the TB cases, and as you see here that the numbers of cases are a little bit slightly decreased, and then it increased again to 2022 with the highest number of cases. But why did it happen? Because our hypothesis said that because COVID-19 was happened in 2020, that's why the people have a different health-seeking strategy. So that's why it's a little bit slightly down, decreased. And people, there was a lockdown. That's why people don't go to the hospitals. That's why the number of cases that we found it a little bit decreased. But then again, when the COVID-19 lockdowns already stopped, the people try to have activities outside, and people that go to the hospitals, the people go to the primary health cares, the numbers increasing again. And also there is the time when there are a lot of program and funding from international, so the TB cases, the coverage and funding of the TB cases increase again. Okay, so this is the result for our study and how the specials, especially for the distributions of TB cases from 2020 to 2022. So the above one is the total number of TB cases for all of the cases sensitive and drug resistance. And the below one is for drug resistant. But if you see here, it's quite clear that the regions like in this Bogor and Bandung, they have a very dark colors, and that means that these places or this regency has the very high number of burden or cases. Okay, so this is our spatial analysis. We use two global Moran index and also local Moran index. The global Moran show is the Moran's eye from 2020 to 2022 has number above 0, so that means it has a positive clusterization, or it has spreading, it's clustered. And for the local Moran's index, it shows that there is a line a little bit inclined, so it's like it's positive correlation. So which means these places like Kota Bekasi, Bandung, Bogor, they are surrounded by the city or regency that also has a high TB number of cases. And this is the result for our risk factors analysis. We do Poisson regressions, and this plot shows that mostly all of our risk factors that we assess have a significant number of p-value because it's a very big data set. It's like 300,000. That's why it's significant. But I just want to highlight that the highest risk of the TB, the DRTB risk factors are, the first one is DM. DM is like the people with DM 2 times higher to get the DRTB than the people with no DM. And also the history of TB treatment has a very big impact on the DRTB, especially for people who treated after loss to follow-up. It's like 29 times higher than the new patients of TB. And also the people who treated in the secondary healthcare, the patient TB, usually they are referred from the primary healthcare. That's why the number of risk of people with the DRTB also really high. It's around 21 times higher than people who treated in primary healthcare who get the DRTB. And also, this is the conclusion for our findings. The number of agencies reporting higher TB burden is increasing from 2020 to 2022. The number of cases is increasing, and there is a little bit decrease in 2021, and then it increases again. But the high key risk for DRTB that we already explained are the 3 things, which are loss to follow-up, people who treated in secondary health care, and also people who have comorbidities in diabetes mellitus. And the special analysis shows that there is a positive special autocorrelations for the urgency that like Bogor, Bandung, and Bekasi, they're surrounded by also urgency with a high number of TB cases. And the last one, we have limitations of our study because this study we got the identified patients, which means we can track them from the development from the first they got sensitive and then they got the drug resistant. If we can track them, that's why it's one of our limitations. And we also can't assess the effect with COVID-19 because we don't have the data for COVID-19 and also the patient with TB at the same times. So I think that's all from our study. Thank you very much for the opportunity.
Thank you, Nurma. Okay. Oh, thank you. So we will have the discussion, question and answers later on. So I will invite Professor Rina Agustina. So she will deliver one of the important legacies that Dojo had that will implement in the next 2 years, entitled Workbook and Manual Book Genomic and Science Dojo. Prof. Rina, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. I would like to thank all the committee of this workshop. It's always been, it's not only about science, but it's also about networking. Yeah, so that's very important. Okay, I would like to present collaborative work actually between many parties in relation to workbook and manual books. We call it Genomic Science Dojo, but of course, if you look at the presentation today, is also covering biomedical science and perhaps also connected to other multidisciplinary framework. Yeah. Okay. In this book, this later can be used also by other counterpart to implement the same type of training program. Yeah. Okay. Do I have to do it myself? Okay. Just next. Yeah. Okay. Of course, we already familiar with this approach, right? Dojo approach. Yeah. So this is actually inspired by the word Shinjitsu. I hope I spell it correctly. So if I'm not mistaken, and with what we also mentioned there, that's actually related to what we call as truth, yeah, or authenticity. So this is of course Japanese word. Maybe we should also think about Indonesian words or Sumatra words or Japanese word, yeah, silat or something like that. So, but of course, this is a way that the approach that draws from discipline to respect. So that's most important. That's actually found in martial arts, where it's focused on creating the learning environment, focus on growth, mastery, and also mutual respect. Once again, it's respect. Yeah. Okay. There are three components here. Yeah. So integrate knowledge and critical thinking. This is very important for young scientists, all of you here, and myself also. I'm maybe old or already old scientist or middle scientist. So this is to encourage learning points, to connect idea, and also think deeply. Yeah. So second, we apply positive psychology and empowerment. So Pak Anu already mentioned about the personal agency, for example. So helping really the individual to build confidence and resilience. I have many experience meeting globally. Sometimes I feel a bit inferior because maybe I'm not because I'm coming from low middle income countries, but sometimes we don't have real data to inform them. So while the other colleagues from other countries, they usually have a lot of big data. But here we actually would like to build confidence. It's really important, resilience to all of the scientists. Yeah? And of course, the last is persuasive language. This persuasive language, how they can not to persuade people in negative way, of course, but of course to communicate their ideas effectively. Like the persons who are doing here, the first winners, second winners, third winners, they are already doing that. How they can effectively convey their message, but importantly, ethically also. That's very important here, these three elements. Of course, this can open with the other elements in the near future if we found that it's really important. Okay, but this is the core three. Okay, so what we want to present here on the book is that it's not just your typical training program. This is new way of training. Yeah, but that's actually important for building and shape the future of science in Indonesia, but also in Southeast Asia region, perhaps also in other low middle income countries. Yeah. So first, on the first blocks, yeah, it's actually moved beyond lectures. Yeah, because team can collaborate. Yeah, they work together to create tangible outputs, yeah, while they're also sharpening their skill, yeah, in data analysis, yeah, and also most importantly, of course, the interpretation. So this can build practical expertise, but also not just the theory. So from theory, they can put it in tangible, practical way. Yeah, and the second one is, of course, the emphasis of learning by doing. Yeah, so then they can have a idea generation. If you experience debate, yeah, in agency, and also push the participant to take scientific action. Yeah, so this actually building the curiosity, yeah, and meets the creativity. So that's what we like to put it there. And the third is actually about empower the participants, as what we informed before, yeah, how we can become resilient. So why, on how? By doing submitting and publishing. Not only just creating, but also we have to publish, because by publish we can communicate the result, yeah, influence the people, and not just learning, a strong support system to make the scientists also growing, and also they can make a real action, a real training, isn't just complete with the voice, yeah, inside, but also the voice outside, yeah. So perhaps also this will give the opportunity to all the scientists to contribute globally, because publishing is actually commitment to contribute global commitment, yeah. Okay. Oh yeah, that's actually the new way of training. So here there's a lot of potential objectives. So there's 5 different objectives that we presented there. First, of course, the objective we want to have a high quality, consistency, and growing scientists. Yeah. Okay. So therefore, the first we standardize the Dojo method. Yeah, standardizing, so everyone later can applying, but we have a standardized. So there's a clear, can be replicable structure for implementing Dojo model across different institutions and contexts. Yeah. So that's the manual can help you on that. And the second is that empower facilitators and mentors. Yeah. So everyone here can be a mentor later. Yeah. Facilitator. So we equip trainers. We call it trainers as sensei. Yeah. Sensei. And we also have judge. What should we call it in Japanese? Judge? We have to find, but we do not put it there, but judge, organizers also here. We have many young organizers with tools, instructions, scoring rubrics needed to run the dojo smoothly and fairly. And in that books, we also guide the participants' learning, yeah? That they can track their skill development, reflect performance, engage deeply with each task, yeah, through structured self-assessment and feedback, and promote independent, scalable implementation. Yeah, and then the last, encourage iteration and co-development. And now you must be curious, how does the book look like? Yeah, okay. There's 4 writers. We also have many contributors, of course. Myself from University of Indonesia, Christina Ihalim from GSI Academy, Yuni from Sam Institute, and Nusa Sankar from Okru. Okay, this is the first book. We call it manual book. Yeah. So what's inside that manual book? We have about 7 components, 7 items. Here about the Dojo principles. Of course, this is becoming the fundamentals of the aspect of the program. It stands for the collaboration, active learning, yeah, and scientific integrity, yeah, as a real principle. And there are also program and activities include all the structure sequence of the activities that has to be done. So if you want to do the dojo, you can look at what the structure is quite complete, what program and activities can be done, and also the roles and responsibility of the sensei, the judge, and all the facilitator. Yeah, and because we do the debate on Institute tournament, there's also a section about that, how this can capstone the challenge, where teams apply their knowledge to solve real-world problem, yeah, using genomic data or biomedical science, and of course the principle is competitive, yeah, collaborative, and also incredibly motivating, yeah. Okay, so then we have since Genomics and Science Workshop, how to organize that. So basically, this manual is really to guide you how to organize the program, and then dojo planning and development. And of course, there should be a contingency planning, which help the organizer anticipate and manage potential disruption, yeah, like flexibility, or maybe there's flexibility is a key, yeah, when working across all the activities here. So here, Christina, Puji, and all the facilitators here has to be very flexible, yeah, but at the same time also meet the key principle of the program. So altogether, yeah, this manual is not only just instructional, yeah, it's a strategic toolkit, yeah, that can be applied at scale, yeah, and sustain meaningful training experience in science and genomics and other biomedical science. Yeah. Okay. Hope we can publish soon. This is almost ready. Just get the UI publisher. Yeah. And then the second one is a workbook. Yeah. Maybe because you are maybe mostly our lecturer also. Yeah. You know, workbook in our university we call it usually BRP, yeah, something like that, yeah. So this has 9 different aspects, yeah, on the workbook. the program overview. A little bit, some overlaps with manual on this one. Of course, they have to introduce even more on this one, especially also relate to theory of change, yeah, and showing how the learning journey, yeah, is designed really to create a real transformation from knowledge to confidence, from teamwork to innovation, yeah. Okay, and then to get that purpose, of course, there should be learning outcomes. What is the learning outcomes? Yeah, here the participants know what skill and mindset they are expected to build. Yeah, and then participants and sensei profile what should be done in order to reach all these learning outcomes, and we need to have a way to deliver that. So we have learning tools, and these learning tools to support learning and also the project work. And there we have a curriculum. Yeah, we have curriculum module, and these curriculum modules is very important to show and offer a step-by-step pathway covering key topics in genomics and biomedical science, and also scientific thinking. Yeah. And then the rules and regulation here also there for ensure fairness and clarity. And there's also tools that we use for supporting the learning point. And last, again, about Institute Tournament, we actually exposed again here to complete the one in manual books. Yeah. So, yeah. Okay. This is 2 books that I hope that you can access later. Okay. Who can use this and how? Yeah. Basically, this workbook and manual book is designed to be highly adaptable and inclusive. Yeah. So although it's standardized, but also it should be clear. And so we want to have ideal for the university, research institute, training program, organization, NGO can use that. And the best part is, of course, is flexible. You can see later how this actually, how they can inspire the scientific thinking, collaboration, and real-world problem solving, yeah, in students or teams or other maybe alumni and their other network, yeah. So how this can be run? It's a short course, 1 day to 4 day challenge workshop, and there's a boot camp style training and workshop, and part of large scientific writing and research skill curriculum. Yeah, so the dojo is ready to use, yeah, for transformative tools for all of you here. Yeah. Okay, so this is just to keep in mind. This is not just a program. This is a mindset shift. This is building a character. Yeah. Okay. Okay. Last but not least, yeah. Okay. Look at this room. All our young minds, although sometimes you are older than myself, but you are a young mind, brilliant mentors. What we have, yeah. And the most important is you are very passionate, yeah, to collaborate. So this is then let's continue to learn, share, and grow together. Okay, of course, thank you, and welcome to the next chapter of Journey at the Dojo. And hope we can enjoy the books and also apply that in more society, build really sharpening the science of Indonesian scientists. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Thank you, Prof. Rina. For that, I will invite all of the panelists. Nuha, Prof. Rina, please. Dr. Apin. Yeah, I think so. And Nuha and Nurma.
Actually, I'm still jet lagged. I just come back from Europe.
Geneva, yeah. Thank you, Prof. Rina, for giving the opportunity in terms of hectic schedule. So now is the time for discussion. So does anybody, any questions for the panelists? Yes.
Hello. Thank you very much. This is me again. This is yeah. This is question for Nuha because your journal very interesting. I quote in your journal in conclusion part, high grades in female though different is not statistically significant for factor contributing to depression differ by gender. Yeah. My question is how can Indonesia close the gender gap in youth mental health by addressing in the social and emotional determinant revealed in IFLS 5 data? Because maybe you don't know, in Indonesia, self-diagnose is common. Yes, sorry for the Generation Z or the millennials, self-diagnose it's common. We don't need to appointment in professional healthcare. So I just really want to know about your perspective about that. Thank you very much.
Thank you. Yeah, thank you very much for your interesting question. Actually, we have mentioned one of the limitation of our study, the tool of using CES during the survey itself. It is a self-reported, as you mentioned, and it is not a clinical diagnosis. So one of the recommendation of our study is that to conduct a longitudinal study, first of all, and then second things using the clinical diagnosis, which will be more accurate to identify the determinant of the depressive symptoms itself. Did I get your question?
So about your audit, it's unmarried 15 for 24.
Yeah, exactly. Yes.
Thank you. Any other questions? Oh, yes.
Okay, thank you very much. Actually, this question is for Fina itself because I'm very interested about your methodology about the dojo, the dojo book, and also the dojo workbook. Because this concept is maybe for me is relatively new for the universities. My question is, I don't know if I catch in earlier or not, but if we want to make this happen, do we need to inform the SID or maybe our crew at GSI lab for doing this, or maybe we need to have the information like this agenda is Economic and Science Dojo, or maybe is there any restriction of our for us to having this? Because if we can make this program accessible, maybe the information will be maybe either lost or maybe misunderstood if there is no information about the permission of doing the mini dojo, like the TEDx and anything else. Thank you.
That's That's a very brilliant question. Yeah. So I think the spirit is that we want to shape the future of science in Indonesia. Yeah. So whoever can apply it and motivate to do that, that's already a good beginning. Yeah. So of course, having this program, you already like a train of the trainer anyway. Yeah. So then because the spirit is collaboration, network, when you want to apply that, it's best to actually collaborate first from the from this scientific network, yeah, and then well, as a scientist, we usually acknowledge the people who actually make the initiation. Yeah, so that's always important. But of course, that is a good point that we need to put it. If someone wants to apply it, what to do, right? So, but the idea is actually, of course, flexible, and maybe the SID can do more advanced answer to this. But as a scientist, I would like to see this being used for the others. Yeah, but of course connected to the first SID team, and of course all the dojo team from the beginning. And after that, you can apply by yourself more. Yeah, so just register first, and then you're going to the first, right, to run the dojo in Semarang. Yeah, so okay, congratulations.
Maybe this is also one of the legacy that probably the alumni dojo network could also facilitate this as well. Like maybe, I don't know, the committees can provide us with alumni network where there is a development maybe for these workshop disseminations later on, so and maintain the environment behind that. Other questions? Yep.
Thank you again, moderator, for taking my question. I would directed my question to Miss from Surakarta. What is so important about mental health? Did you encounter that mental health that have something to do with Indonesia Golden 2040? And also, does it have positively correlated with GDP per capita for Indonesia? Thank you.
That's a tough question. Nuha, just a little bit additional info. Please put your mic closer before you.
Okay. Thank you very much for the question. Actually, suicidal, especially among youth, has been increased, especially the last year. And according to the WHO report, that almost 35% of the suicidal. So what is the reason for the suicide? One of them is that depression. And the second thing, most of us, maybe we will have a depression, but we don't know that we have it. We cannot diagnose it. And the third important thing is that stigma. Well, if I have, what about, oh, should I go to the psychiatrist? What people will say about us? So that's why many underdiagnosed people, they don't know that they have the depression. That is the reason. Now, mental health should be an important public health problem that we don't know. We don't have any concern about that problem. That's why we should focus on that. And then also the government in Indonesia, they have a limited budget that is giving it for the mental health. The second thing is that in Indonesia, 0.29% is the number of the psychiatrists, the professional psychiatrists. However, the normal range should be 1.2. This is a report. Yeah, so there is very big shortage about that. Some province also doesn't have a tertiary health care for that. And mental health cannot be accessed in the primary health care. You should go to the tertiary health care just to meet a psychiatrist. That's why it will be helpful if we can conduct the mental health in the primary health care. So at least from the first meeting that you can at least diagnose a little bit in the mental health disease. And the last thing is that lack of awareness and educational. That's why one of our recommendations of our study to include some curriculum in the school to teach the students about the symptoms of the depression and what are the causes, so people will be aware. And one of the most important things is that about the smoking. We know about the smoking is in Indonesia, and Indonesia ranked the second country which has the factory of the smoking, right? So now the government will be between two things, between economic and then also with the help of the people, which should one I follow. So we have a lot of the challenges. Yeah, thank you.
Thank you, Nuha. That is quite contradicting to one another as well. Other questions? Otherwise, I would like to have my questions to both Dr. Apin and Nurma. So, to Dr. Apin, you're saying that most of your observations are not significant different. Does it also relate to the subject samples sample size that you use? If you have any chance to do bigger studies without any limitations, what kind of further research that you are going to develop with your current hypothesis?
Yeah, that's a very good question. There are previous studies about Roland epilepsy. Most of the studies were conducted in
high-income countries like in Europe, still few studies in low-middle-income countries, especially in Asia and Africa. And most of the studies were actually, it was a small sample size because it's a quite rare condition in childhood epilepsy. But I've seen some of the previous studies had larger subjects, not until 100 subjects, but it's about 50 to 60 or 70 subjects, and they can have conclusion of significant correlation statistically. So I agree with your question that it might increase the possibility of statistic significancy, and most of the previous studies were also case control, and I think it's much better to continue the study with longitudinal study, cohort longitudinal, and also yeah, at least it's a longitudinal study, because as far as I know, in many studies with limited subjects or rare disease studies, they use longitudinal study, and it's still we don't have such studies in Indonesia, so I think it's a very good idea.
Okay, and for Norma, like you mentioned about the key factors for the TB associated, that I saw that as an enabler and a disabler. So like, for example, the loss to follow-up thing. This is also related to actually the treatment adherence that induce the drug resistance itself. And within this economy, that was like a many Gen Z's phrases. With this economy, like, how do you think it will affect the enabling and the disabler system for TB treatment or notifications?
Oh, that's very interesting questions. So, so you're asking about enablers and disablers factors. Well, it's really interesting because people who lost to follow-up usually doesn't adhere to the medication because, first of all, for male, usually they are working, so they can do the monitoring or go to the primary healthcare just to make sure that they really consume the medications. And also there is a stigmatization about people who got the tuberculosis. I mean, when they had tuberculosis, they feel like how to say that they cause themselves not to have a interaction with many people because they feel like it's it's communicable disease that they would spread this disease to others, and that also made them like they don't want to go outside or just come to the doctors to get the medications. Also lost to follow-ups because some TB drug resistant, they have to take the medication for a very long time, like it's months, and that's why people maybe feel like it's like maybe bored, or they think like I'm getting better, so they just stop the medications and they continue again. That's why it's one of the factors that they don't want to. This loss to follow up could be happen, and that's all would lead to the drug-resistant tuberculosis in the future. So after they stop the medications of them, they think that they are getting better, and then they just feel like they're getting worse again, and they come to the primary healthcare or just to go to the doctor to see what happened to them, and that is drug resistance. So yeah, so there are many factors that why people get drug resistant and lost to follow up. Yeah, there's a lot of things that needs to be improved in the futures, and it's our homework for especially for the government, how this could be improved in the future as well. Yeah.
Where do you think it will lead to? TV program. I think it's very effective.
Yes.
The economic background really stand behind all the successful
Correct me if I'm wrong, but I heard also that the support of medication for the TB from the USA is stopped as well, right? So that means that the people who treated with TB also, they couldn't continue again for the medication. So with this economy, and maybe if they have to get their own medication or support, it will be more difficult. And also with this economy, I'm not sure, but if we want to try to find out with the malnutrition and people who can afford the nutrition, good foods for themselves, and they have the lack of health conditions and malnutrition, and it would make the TB worse. The condition would be worsened with that. That's just my hypothesis, but we need to.
Thank you. So I think it's 11:30. I think we're running out of time. I would like to ask everybody to give applause for our panelists and Prof. Rina. We hope to see the book as soon as possible. And I would also like to give applause for the senses behind the panelists, Prof. Anu, Pak Adit, Pak Husna, Edward, and everybody, and especially for the committee of their long commitments and the CITES as well. It is a huge job. And also here, Pak Ahmad as the first partners of Dojos, and he continuously support in Dojo behind the scenes. So I would like my grateful sincere to Dojos and all of the people behind, and hopefully we can get some key message after this. Looking forward for the new network collaborations, new ideas, and new trainings after this as well. Thank you, and I will give it back to the Rona.
Okay, thank you. We are going to give a plaque for all the panelists. Thank you for the exciting dialogue. Maybe for all the panelists, you can stay at the stage. And Miss Yuni, we need your help to giving out the plaque. So first we are going to give, for Nuha, Nurma, and also Dr. Apin, can you please stand in the front? Okay, so first, Miss Yuni. Okay, we are going to give to Okay, we are going first to give it to Nurmalita. So, okay, please go to the center. Then smile to the camera. 1, 2, 3. Thank you, Kanurman. Then we are going to give it to Nuha. Okay, we would like to invite Nuha Sensei.
Edward.
Mr. Edward, can you please come? Oh, he's on a meeting. Okay. Okay, so Sir Anu will. Okay, smile to the camera. 1, 2, 3. Okay, thank you, Nuha. Then we're going to give it to Dr. Apin. Yes, so Dr. Apin Sensei is Sir Anu, so Sir Anu is going to give the plaque. Congratulations, the second winner. Okay, we're going to smile to the camera. 1, 2, 3. Okay, last we are going to give it to our respective sensei and also our source of material for the dojo, Prof. Rina. Give an applause for Professor Rina. Thank you, Prof. Rina. May your impact prolong for a long time. And last but not least, we are going to give a token of appreciation to our moderator today for Bu Ati. We are going to give you a plaque so you can stand in the center, the front. Thank you for your exceptional guidance for today. And we are going to take your picture and smile to the camera. 1, 2. Okay, for all the panelists and Bu Ati as the moderator and Bu Yuni, we are going to take picture for all of you with the plaque, of course. Okay, everybody. everybody go to the center. Then we're going to take a picture. So big smiles. Okay. Okay, right angle. Okay. Smile, 1, 2, 3. Bigger smile, 1, 2, 3. Okay, give an applause. Thank you for all who participated in this event. You may all go back to your seat. Okay, that concludes all of our dissemination today. We would like to convey our thank you for the participants and the organizers. And I would like to give a little announcement for you to fill out. There will be a feedback form, and the link will be displayed on the screen. So make sure you fill out and complete it once again. And there's a particular information to fill out with your full name and your academic or professional title, so we can acknowledge you by the form. And then after this, you may go to the mushola or the mosque around us. If you want to go to the nearest mushola, there's a mushola in front of this room, and the wudu you can take it in front of beside the mushola in the toilet. And then we are going to wait for the feedback form to be shared in the screen. So I need a little moment of you. Okay. For efficiency, you can capture this screen, and after you already retrieve the link, you can go straight for another activity. You can use this time to network with others. And as for today, we would like to say thank you again, and a special message that we hope to see new faces in the next dojo, and we hope you all luck in your next journey ahead. And thank you. I'm officially closing today's dissemination. Thank you for your time. Have a nice day. Oh, okay. We are going to take group photos now. So, can someone direct me on how are we going to go? We go through the group photos. Everybody go to the front. Okay. So, I invite all of you to stand up, and we are going to clear the stage. Okay, we are going to take pictures. Okay, we're going to arrange chairs at the front for the senseis. Mas, kursinya taruh depan. Ya. Iya, respected aja. Okay, everyone, let's go to the front. Let's move to the stage behind the chair first. We are going to have Sensei, Mr. Anu, Dr. Ariel, Dr. Irene, Bu Ati, Pak Ahmad too. For the rest of participants, let's go to the back of the stage. You can follow me now. Here. All the rest of the participants. Okay. Everyone.
Okay. Make your way. Pak Husna, you can sit here. Pak Ahmad, can you sit in the front? Pak Ahmad. Oh, okay. Okay, for everyone who feel taller, you can stand at the back of the stage. Oke, Mbak kerudung biru bisa maju, tukeran sama depan ya. Oke, we can see you right now. Oke.
It is a really good platform to grow, to develop our research idea.
For me, this event is revolutionary because we as a scientist can meet with a lot of people from different fields that we can connect.
I gained so much knowledge, so much skills, and so much experience from this event.
I think this is the very good start if you want to embark your journey in doing research.
It was a remarkable event for us. We met a lot of young scientists and people from all over Indonesia that we would never ever dream of to connect with if not for this event.
Thank you for arrange this Genomics Dojo. It really helped for the junior researcher like us. Thank you so much.
Saya lahir dan besar di Lombok, tapi
I was born and raised in Lombok and studied to be a midwife in Mataram, the capital city of West Nusa Tenggara, Indonesia, where I completed my studies to become a midwife. After graduating from school, I was appointed by the government to serve in the Central Lombok district as the midwife at this maternal and child health post called Apolindes in the village of Tanah Au. It is surrounded by rice fields where many of the people work. My name is Dwinta and I have been a midwife here for 14 years.
Kenapa saya memilih profesi bidan? Karena
Since I was a child, I always wanted to be a health worker. My mother was enrolled in the nursing school but couldn't finish. So in a way, I'm also fulfilling my mother's dream. My home is attached to the Polindes, and I am here for the women 24 hours a day. But sometimes it is difficult for women to make the trip to the Polindes. If a woman can't make the journey, I will go to them at their home and deliver the services there. For many women, I am their primary source of healthcare, so it's very important that I keep good records of their health and maternal progress, as well as their baby's development. Until recently, records were kept in paper books that I would store at the Polindes. Sometimes, the record books would be damaged by mice and insects. If a patient left the area or needed to travel to the city to see a specialist, there was no reliable way to make their records available outside of our village. But now, I have a tablet computer with an application called Bidan OpenSRP that I use to enter the women's health information, and their babies too.
We actually enable the health worker to share the data to the other workers automatically. DRIVE is a research project which wanted to assess the health impact, whether it could actually increase the service coverages of the health workers, the quality of the services that they're given, as well as if it is in a timely manner or not. OpenSRP is the health technology which is used by DRIVE for their research. They actually use the power of the 3G and 4G.
I also serve at a monthly clinic called a Posyandu. where other health workers come together to serve all the pregnant women, new mothers, newborns, and children in the area. Everyone in the village can come. The other health workers also use OpenSRP on their tablets. All the data that we have as a team at the Posyandu is synced to each other automatically. This ensures that we all have the same information and that we don't miss or duplicate important things like vaccinations or medicines. The Thrive OpenSRP application also has a facial recognition feature. This helps us locate their records quickly and ensures that we accurately match the right records with the right woman or child.
In Indonesia, people have a lot of same name. For example, Putri something. Which Putri is this? So the facial recognition will make the frontline health workers that use the app easily detect the right person for the right information.
SMS reminder.
Additionally, the OpenSRP application sends SMS text to me and the mothers to remind us about our appointments and for them to take the medicines or vitamins or any other activity that is.
Development adalah sebuah lembaga non-profit organization di daerah timur Bapak dan Ibu, yaitu di Lombok. Jadi kami tugas utamanya adalah menjadi mitra dari mitra-mitra kami di wilayah, terutama di Dinas Kesehatan, kemudian Kementerian Kesehatan, yang tujuannya menjembatani antara penelitian dengan implementasi program.
Kalau riset proposal ini sudah tersusun, biasanya kita sudah bisa menghubungkan ini akan diajukan untuk pendanaan di mana, hibah di mana. Karena tidak mungkin suatu proposal research kita lakukan dengan biaya sendiri. Itu untuk saat ini terutama Genomic itu sangat tidak memungkinkan.
Tapi di BRIN juga ada yang namanya Research dan Inovasi Indonesia Merdeka, RIIM. Nah itu dari setiap universitas atau pusat penelitian itu bisa bergabung untuk mengajukan proposal pendanaan ke sana. Ini ada sesuatu yang perlu diperbaiki dari sistem kebijakan kita, dan sekarang sudah ada teknologi yang sebenarnya allowing kita untuk mendapatkan data sehingga kebijakan yang diambil nanti berdasarkan evidence. Kemudian bentuklah BGSI.
Apa yang kita pelajari di sana sebenarnya semua itu keterlibatan dari peneliti muda. Dari mulai probiotik dan diare kami melibatkan 100 coworker ya, karena itu memang penelitian yang sangat long term. Kemudian kita juga melibatkan semua lini tersebut adalah platform yang dibentuk untuk para peneliti muda.
We also have independent bodies involved in that, so like a media science center where individual expert researchers say, I am willing to be contacted by the media to give a scientific, objective opinion on something that is being spun and happening in the media.
And I really love the concept of the dojo. Its very name refers to a culture, right?
Yeah.
And the Japanese have this dojo where people go to learn martial arts in a refined, polite way.
Yes.
Banyak peneliti muda, banyak anak-anak muda yang mungkin melihat apa sih sebenarnya kontribusi mereka gitu ya di masyarakat gitu, atau mungkin di penelitian atau mungkin di aspek-aspek lainnya. Kita membawa mereka di Summit Institute dan tentu bermitra dengan mitra lokal tadi untuk menciptakan suatu perubahan.
Mendisiplinkan diri untuk membahas dengan baik, dengan tajam, tapi tetap dengan kearifan lokal. Yang kami maksud adalah dengan kesopanan yang kita ketahui gitu, dan dengan tata krama yang kita ketahui. Karena komunikasi sains itu tidak hanya tertulis, tapi juga dengan presentasi, dengan diskusi dengan senior ataupun dengan junior, dengan diskusi dengan profesor, dokter, dan banyak narasumber lainnya.
the CEO of Summit Institute for Development, a women-led non-profit organization dedicated to improving public health and human development. Started in 2000, SID has a proven track record, notably through a large-scale double-blind RCD Summit trial, demonstrating the impact of multiple micronutrient supplementation on the reduction of neonatal mortality and improve pregnancy outcomes that have shaped global and national recommendations. We are co-founder of Open Smart Register platform that is used by frontline workers in 17 countries to monitor and improve service delivery. As a key partners of Indonesian Ministry of Health, SID plays a key role in improving data use for action and closing the gap in care for women and families.
We aim to reach 10 districts across the country with 10 million people and expand our work to Eastern Indonesia and global communities.
Our work involves training frontline workers, community education, and also developing and deploying digital health platforms to enhance access and quality of care. SID prioritizes women as the primary beneficiaries. Our unique approach involves enabling team-based care and data for action. We are also having well-trained community health promoters. By focusing on human resource improvement, community engagement, and digital health, SID aims to improve maternal and child health outcomes to thriving generation. Hello, I'm Yuni Dwi Setiawati, the CEO of Summit Institute for Development.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I learned a lot about how to communicate the research.
The sensei are very kind, very mindful, and also gives me more perspective about the scientific method.
Really new knowledge for us to dive deep more.
From this dojo, I can learn how to do a public speaking, so it was really fun and interesting.
If you are up for the challenge and you want to improve yourself, push your limit, we recommend you to join Dojo Science.
It was a very fun event because I